Yep, can you hear me?
Thanks, Bill.
Hey Andrew, how's it going?
Thanks. Yeah.
What
So,
did you use today?
just what? Yeah. Question.
Hey, Andrew, I don't know if you can hear me. Brilliant. Okay. Yeah, easy.
Pretty sure. Are you guys met or what do you guys do? Oh, we're science. We're science graduates. We actually just finished our degree. We're just having fun. I think you learn a lot. I think it's nice. So we're gonna be learning. Yeah, we didn't really come that prepared. Like, are we gonna be so preparation? I'll get you you guys. Yeah, do you guys have tech or right. I just sorry, I just did yeah. Qua
Yep.
he works. So
Okay, great. With the no cooker, so would he be like going through the slides?
I assume so.
And we'll just be.
Yeah.
Is everything working?
Yeah. Do you guys want to grab a seat? We're going to get started now. Do you guys want to grab a seat on the stairs? Yeah.
Preferably sit with your team, but if you don't know your team, that's also completely fine. So just yeah, sit down.
Yeah. All right. Thanks so much for coming, everyone. When we booked room 101 for this competition, we weren't expecting it to not be a room, but I think this actually works out. It's pretty cool. And then we'll have collaboration spaces upstairs as well. So without further ado, we'll introduce Kwa, let Kwa introduce himself and get started.
All right. Hi, everyone. So my name is Qua. Thanks for the introduction, James. I'm going to quickly introduce myself. So welcome to the Biodesign and AI case competition. So my name's Qua. I was a Monash graduate a couple of years ago now. I studied medicine like a couple of you in the crowd, and then also studied public health in London. Worked as a doctor for a couple of years at Austin Health in Melbourne, and decided that I wanted to have a desire for greater impact. And so I completely kind of changed tack and studied engineering at Stanford and also studied biodesign at Stanford as well, which is going to be the focus of today and tomorrow's case competition. I then did the very Stanford thing and did a neurotech startup. I kind of got like enamored with the startup world in the Bay Area. And then I joined Monash as an associate professor and founded a medical AI lab at Monash. So I'm actually dialing in from San Francisco, which is why I can't join you today. Along the way, also worked at a couple of like really cool projects like medical AI for diabetic retinopathy diagnosis at IBM Watson, which is this old like AI initiative at IBM that was really cool at the time, but like didn't really end up working. Surgical AI at Oxford, as well as adaptive brain-computer interfaces at UCSF, which is the University of California, San Francisco. So why did I switch to medtech? The first thing is, you can have a lot of impact in medtech, as you'll hopefully find out from today and tomorrow. What you kind of invent can really start to impact, tens of thousands of lives or hundreds of thousands or even millions of lives. So a lot of really cool products have been created by, people like yourselves. Like you don't have to do medicine, you don't have to do engineering. You could actually, be in a completely different field, but have a huge impact because of what you invent. Um, Secondly, building is really fun. Hopefully, you kind of get a taste for building. Like, building is getting increasingly easy because AI is just like, like you can ask AI anything these days. You can use AI to vibe code, you can use AI to like vibe mechatronics or even vibe biodesign, which is the hope of this case competition. If you haven't really like gotten into it, we do run some vibe coding workshops for our lab, so keep an eye out for that, where we basically teach you like in a weekend to pretty much like code something really cool and really powerful. And finally, this field is really good at rewarding creativity and curiosity. There's lots of fields where, if you're creative, if you're curious, you kind of get beaten beaten down a little bit, right? But in medtech, like creativity and curiosity is really powerful force. And so that's kind of, there's nothing greater than just like learning something new and being able to apply it and kind of use that kind of knowledge that you have. So yeah, I run the Cal Lab for medical AI and medical technology, and our mission is to build medical AI and medical technology to push the frontiers of medical knowledge, as well as make world-class healthcare available for all. So we have a website here, which you're welcome to check out. It's kind of like an old school website from Monash University, but you can get a feel for like what kind of research projects we have. And these are all the lovely people you might see in the crowd who are also attending this from our lab. And feel free to say hi to them and ask them about some of the stuff we're doing. Okay, James, would you like to introduce yourself?
Yeah. Hi everyone, I'm James. I'm a final year medical student at Monash now, and I've been doing this for a few years, and mainly with the same reason that Kwa started with, just seeing what else is outside in medicine and how I can make a greater impact. So it's been really fun teaching and researching with Kwa over the years.
Hey guys, my name is Mark. I'm currently studying engineering and science, third year. I got to know about this basically through my internship at MIME, and it uses the biodesign process to kind of see if there's any unmet clinical needs. And I kind of liked the whole thing and got on to this lab uh, this year. I'm involved also in MIME and MBSI, which are also in the medtech area. And I'd like to make a big impact on optimizing health with the technology that's currently available and emerging today. So yeah, pretty much.
Great, thanks, Mark. Yeah, so my name's Isabella. Similar to James, I'm also studying medicine, but I'm in my third year right now. I'm placed in Bendigo, so I usually travel back to Melbourne on weekends. But yeah, so in my first year of medicine, I actually ended up originally attending one of these programming boot camps, and that's how I started to pursue this journey myself. So I self-studied a bit of programming, and through that, I joined Kwa's lab. So apart from that, I think that's where Vernexus really came from, which I'll explain in a few more slides. But apart from that, I also recently joined NextGen Ventures as an investment associate. So that's just a student-focused VC firm that backs Australia's most youngest and ambitious founders. And I like to consider myself a bit of a professional side quester. So I like to travel whenever I can. I recently represented Australia at an international youth forum in Japan. And fortunately enough, I'm going to New York later in the year for the Monash Global Discovery Program, which I'm very excited for. But yeah, that's a bit about myself and a bit about Nexus now. So I think we kind of realized in at least my first 2 years of medicine that there was kind of this gap between there was a bit of a high barrier to entry, especially for medical students, into this field of medtech because of how technical it is. And so kind of our goal at Nexus is to create this bridge between med students, doctors, and innovators with AI and medtech. So yeah, if we can go a few slides forward, if that's all right. Great. And so we run a lot of different events. So obviously we run events like this one. We run other sorts of boot camps, vibe coding hackathons. And at the end of last year, we also ran an international medical AI challenge, which was super exciting. But the whole idea behind Nexus is to create these interdisciplinary spaces where you not just have people from med, but people from engineering, commerce, tech, from all these fields actually communicating and collaborating with each other to hopefully shape the next generation of innovation in medtech and AI. So yeah, that's it about Nexus.
Right, awesome. Thank you so much. So please remember these faces because they're going to be the ones, if you have any questions, like please reach out to them. They can be also helping out with advice during the competition as well. So yeah, say hi if you can to Isabella, Mark, and James. All right, so our agenda today is going to be, the following. So firstly, I'm going to talk about MedTech 101. So I know a lot of you may or may not have spent that much time in MedTech, right? So I just wanted you to have basically an introduction to how we think about medtech in the field, right? Just so there's like some common language. We're then going to talk about the motivation and the goals behind the case competition itself, right? So this is the first time that we are running this. And there's kind of like a vision we have, and we want to see if it works out. So we'd love any feedback. We'd love to hear your thoughts on how it went. We're then going to focus on the kind of, the main part of today, which is we're going to talk about the Stanford Biodesign process. We're going to give you what you need to know. Now, this Biodesign process is a 12-month program at Stanford, right? Like full-time 12 months, right? So we can't teach you everything in the 12 months, but we're hoping that AI actually has become powerful enough that you can basically like vibe biodesign, right? You can really lean hard on AI to do some of the hard work of biodesign, right? And so we're hoping that to just basically give you just what you need to know, the kind of absolute highlights, so you can become really good at this process. Then I'll hand over to the rest of the team to talk about the competition platform that we've built called EFA, and as well as talk about what the case competition actually is and what the competition is like and what the prizes are and so on. All right, so if you have any questions, please go to this. So save this link, save this QR code. I have a second screen here where I can actually see questions pop up. So if you have questions, I think the easiest way is just to respond on this form. So please just make note of it in case there's anything you want to ask at all. If there's any questions, like happy to answer them. And please ask questions because if you have that question, someone else will have the question as well. Biodesign can get a little bit complex, right? So I expect questions, right? Because if there's no questions, I just assume that you kind of don't understand anything I'm saying. Okay, so save that link down. All right, so let's talk about MedTech 101. So what exactly is MedTech? So MedTech is any technology which solves a healthcare problem, okay? And this is really, really broadly defined, right? So it could be for a certain disease, like cancer or heart disease or whatever. It's like a major, major disease, right? But it could also be for healthy individuals, like say you are, sleeping pretty well, but you want to improve your sleep. That is also medtech and health tech as well, right? So there's no kind of distinction between, improving something that's already good versus, improving something that's quite bad, right? So medtech is a really broad kind of thing to have. And there's lots of devices that you can see here that actually constitute medtech, right? So a lot of people might think, really complicated stuff like MRI or CT machines, robot surgeons or like, ICU machines, that kind of stuff, right? But it also includes the simple stuff as well. Like a Band-Aid is actually considered a medical device. Like this pad thing is a medical device. Syringes are a medical device. A stethoscope is a medical device. So they're all really kind of broad things, right? And so yeah, we kind of welcome solutions of all types, right? You don't need to be super into engineering to have to be involved in medtech. Okay, it can really involve just simple design, simple materials, nothing really complex. Now, we actually divide medtech into three main disciplines. The first being drugs and biotechnology, and we'll talk a little bit more about that, but these are basically things that operate at really small scales. Okay, so stuff that's like, on cells or at the molecular level, for some drugs. The second, the second is medical devices. And these are hardware, things that you can hold in your hand that operate on a macro scale. Okay, so kind of like, for example, like glasses, that's a medical device, or a hearing aid, that's a medical device. So much larger things. And then the final thing is digital health or medical AI, right? And everyone's obviously been really excited about medical AI recently. But these are things that operate in the digital realm. Okay, so these are the three disciplines of medical technology. All right, so let's talk about drugs and biotechnology. So this is technology that operates at a micro scale. Okay, so we generally think of things like DNA, RNA, proteins, kind of molecules, right? It could be things like cancer, vaccines. It could be things like genetic editing. It could be things like, immunotherapies. So there's lots of kind of cool drugs that you can basically operate at the micro scale. The second type is medical devices. So this is technology that operates at a macro scale. And we usually talk about these operating on things like tissues, cells, and organs. Okay, so kind of larger things. Now there is, some drugs that actually work on cells, right? So this is kind of where it might be a drug, it might be a medical device, right? So these aren't very clear distinctions sometimes, right? But broadly speaking, it's something that you can hold in your hand. Okay, so things like band-aids, things like pacemakers, things like, glucose monitors, that kind of stuff. And then finally, digital health and medical AI. So this is apps, obviously. So anything that's like a phone app or web app, as well as AI. And AI, as you're probably aware, is getting ultra powerful with this. Like it's just crazy that a couple of years ago, there's no way that you could have asked something this complex and AI actually understands what on earth you're saying. Okay, so it's kind of been very exciting from a medical AI side. And it is possible to combine these fields as well. So, for example, a nicotine patch, right? So that's considered medtech. That is both a drug because you're delivering nicotine, as well as a device because it's something that you can hold in your hand and put on your skin. The derma sensor. So this is a device that essentially takes a look at a mole. So it just kind of looks through a camera at a specific mole on your skin, and then it tells you if it thinks it's skin cancer or not. Okay, and so this is, for example, a device plus AI. So it is possible to have combination devices. MedTech itself is getting kind of crazy. There's lots of stuff that I think going through med school, even just a couple of like, I don't know, like 5, 10 years ago. I don't want to kind of like give away my age, but there's stuff that like even in med school, we were told it was impossible to solve, right? Like a classic thing is obesity. Even a couple of years ago when I was studying at Stanford, I was trying to look at see if we could cure obesity with like a certain technology we had. And all the people, all the smartest people in the world on obesity were like, look, you can't solve obesity, okay? Like it's just not possible. And then Ozempic comes out and it has pretty much solved obesity for a huge swathe of the population, right? And this is a really, really powerful drug. Very, very cool. Now, this is actually a Melbourne-based thing. So this is a Melbourne-based startup from an ex-doctor, but it's essentially a bunch of brain cells playing Pong, right? So pretty cool technology. Like I don't know what the potential use cases of that are for medtech, but like there's just like science fiction-y stuff happening. This used to be an old pacemaker, kind of like 10 or 20 years ago, but now pacemakers are ultra, ultra small. You can see how like we've basically like shrunk the electronics of a pacemaker into something very, very small. And so instead of having this giant thing, in your chest, I don't know if you've seen like someone with a pacemaker, they have this basically implanted into their chest. So you can literally see it if they have their shirt off into something very, very small that you can just basically embed into the heart, right? You just put it into a little cavity of the heart, and that's good enough for a pacemaker. IVG is a pretty cool technology, like a biotech thing that I've been hearing about recently. So there's a couple of startups in the Bay Area that are looking at this, but essentially it uses, you can basically get like skin cells from different people, and then you can fashion that into an egg or sperm. And it doesn't matter what gender these people are. So for example, you might be able to take cells from me and then make an egg, or you might be able to take cells from a female and then make sperm. And then you basically use IVF in order to create a human embryo. And that kind of, creates all sorts of like weird ethical questions if you think about it, because theoretically you can have a child with yourself, right? Because you can get some skin cells from yourself, turn some into an egg, turn some into a sperm, and then create, human embryos with yourself, right? Or you could, just like change the gender of the eggs and sperm and be able to basically create a baby there. So lots of kind of weird, and interesting ethical questions that might come from this technology. Now, some of you may have never seen an MRI machine, but when I was going through med school, an MRI machine would take up basically like a whole room. It's like a massive, massive technology. But MRIs have now actually shrunk to basically something you can push at the bedside, right? So this is really, really cool medical device. I'm seeing a question here, will we gain access to these slides afterwards? The answer is yes. So we actually have it in the case briefing, so you can look back at this. And then last but not least, AI is starting to change everything, right? Like every day, like millions of people ask ChatGPT and Claude or whatever it is for health advice, right? So the role of doctors is also changing as well. So big questions there. Now, a kind of really important thing that you need to get in your head for medtech is that it is a regulated field. Okay, so there's lots of fields like, when you try to sell something where it's not regulated. Okay, that is, you don't need to get permission from someone to sell. So an example of that is, I suppose like an example of that is, say you want to sell laptops, right? If you want to sell laptops or you want to sell phones, you don't actually need to get permission from that many people. You can, for example, create a phone and then just start selling, right? Another one is food, right? Like you can start cooking food as long as you follow some rules. You don't need to get permission from people to sell. Okay. Um, Unfortunately or fortunately, medtech is a regulated field, right? Which means that you need to get permission from someone in the government before you can sell a device or biotech or software. Okay. And the reason for this is that the general public can't really distinguish between good or bad devices. Okay. So if I, for example, tell you that I have now a robotic surgeon for you, right? You can't really figure out if it's good or bad, right? Like someone who's an expert in that field has to help you do that, right? And so because of that, you need to get approval for medtech from these organizations here. Okay, so in the United States, it's the FDA. In Europe, it's CE. And then in Australia, it's the Therapeutic Goods Administration. Okay, so before you can sell any product on the market, you must get permission from these agencies. Okay, so it's kind of very interesting because it changes the dynamic of how you do medtech startups. Because the whole point is to get permission, and then from there, you can enter the market and make money. But before then, you cannot really sell to anyone. You can't really make any money. So kind of very interesting dynamic. And there's a couple of other fields as well that are regulated fields. So for example, you can't sell a plane without getting permission from someone, right? You can't just randomly go around selling a plane because someone needs to make sure that that plane is safe, okay? So there are lots of fields where they are regulated and they change the dynamic. Now, medtech is also very unique because there are lots of stakeholders. Okay, so as you can imagine, if you've ever been inside a hospital, there's obviously the patients, there's the clinicians, there's the hospital or clinic that you're working with, as well as Medicare and insurance. Okay, and unfortunately, everyone has to be happy before you can sell something. Because as you can imagine, doctors treat patients, but then patients choose to go to a certain hospital or clinic, and then that hospital or clinic employs a doctor, right? So it's kind of like this triad of these three. And then outside of that is Medicare or insurance, right? So, when you get treated as a patient in Australia at a hospital, you don't pay anything, right? Medicare actually pays for most of it, unless you go to a private hospital. Now, if, for example, you go to a GP, again, Medicare pays most of it. But if you go to a specialist, then the patient will foot, around 15% of the bill, right? Again, Medicare pays for it. And so all these parties have to decide that they're happy to buy something, right? Because the patient needs to be happy that they're going to be treated. The doctor needs to be happy that they're actually going to prescribe it. The hospital or clinic needs to have it around, somewhere in the hospital. And then Medicare needs to be happy that they're actually going to pay for whatever you've created as well. And so there's lots of stakeholders involved in medtech. All right, any questions before we kind of continue here? So feel free to write any questions for medtech, particularly if it's like kind of your first time seeing this stuff. So I'll give you a couple, I don't know, like a minute or so to do that.
If anyone would like to ask questions directly, please raise your hand.
Okay, I'm seeing some questions. One is, how am I today? I'm feeling great. Thank you. All right, a second question is something like Heidi Health. So for those of you who don't know Heidi Health, it's a note-taking app for clinicians. So one of the kind of biggest problems that clinicians have is that when you're talking to the patient, you also have to take notes to document what you're doing. And so Heidi Health uses AI to basically listen in on the conversation and then summarize a transcript of it and provide a summary that you can copy into your notes, right? It's one of the kind of hottest medical AI startups in Australia now. I think the valuation just reached 1 billion. So a very kind of great success story. So a big question is it considered medtech even though it doesn't help health? The answer is yes, because you are helping clinicians as well, and that indirectly helps patients. So it would definitely be considered health tech. Any other questions? Could I just get a confirmation or not? Okay, actually, there's tons of questions now. How do you judge if an idea is valuable or impractical? That's a great question. We're actually going to cover that later today, so plenty of time to discuss that later. How are these regulatory bodies keeping up with medical AI capabilities? Are they stagnating? And what does that mean for what we can do? Are there sort of loopholes that you can game? That's a great question, actually. So regulatory bodies are not keeping up with AI that well, actually. They're supposed to try and be proactive. So, for example, in the US, they're pretty good at it. Like they will realize that they're pretty bad at, regulating medical AI, and then they get a bunch of experts in, and they keep on having these discussions as to like how to improve things. Um, Unfortunately, in Australia, we don't really do that. We kind of just wait for the US to do something, and then we're like, okay, that's a great idea. We're going to take that, right? But obviously, there's a bit of a lag, right? So, with something like medical AI, we kind of expect the TGA to have, their kind of, stuff together by probably around like 5 or 10 years later, right? So they kind of have a bit of that lag, right? And so during that lag, there's a lot of confusion, to be honest, because if you're doing medtech, you just want to know what the answer is, right? You just want to know if you have to apply for TGA or you don't have to apply for TGA, right? Um, and you don't mind either way. You know what I mean? Like it's not like super, super hard sometimes. But yeah, like so there's a lot of uncertainty, and so unfortunately, med tech startups in Australia struggle a little bit. But part of the answer is that you actually go to the US because it's a much larger market. And there's regulatory certainty, right? So the FDA kind of like tells you what it's thinking. It constantly keeps on, publishing all this stuff on what it's thinking. And yeah, so there's lots of loopholes that you can gain because of that. How to build up hype for your product to engage the market? Yeah, that's a great question. So I'm not like an expert in marketing, but like a lot of people are really good at like building hype. Like unfortunately I'm not, but like, there's like all these people who will have like all these strategies, could be via TikTok, it could be via Insta, or IG. And it's just like there's lots of different ways that you can basically like get people using your product. But yeah, I'm not an expert in that. So I think like I'm not going to answer that as well. Will applying AI in medicine reduce like cost for patients in general? Yeah, that's a great question. Like potentially. Yeah, we don't know because there's also a profit you like, tied to using AI as well. All right, I maybe just answer two more questions. So if people become more dependent on AI for their own healthcare, do you think this will worsen people's trust in doctors, and lead to delayed presentations to hospitals? That's a good question. I think it's very context dependent. AI can be done well, AI can be done really poorly as well. And then final question, if I'm interested in learning to code, what is the best way to start learning? Um, so we generally code in Python, right? So that's a very popular language, but at the same time, because you're vibe coding, so you're using AI, you don't really need to know different languages, actually. You just need to know how to use the AI. And so if you're interested, you're welcome to attend our vibe coding workshop, and then we'll kind of teach you how to do that. All right, so let's move on. All right, so let's talk about the case comp goals. So the kind of motivation behind why we put this case comp together is pretty simple. One, AI is making it easier than ever to build new things and start your own company, right? So I think a lot of people were blown away by this guy. And this was just last week in the New York Times. This guy managed to build a medtech company just by himself and his brother, like later on, that is worth now like $1.8 billion. And he only built it within 12 months, which is pretty insane if you think about it, right? So, there's been these kind of predictions that there will be a one-man billion-dollar company or one-woman billion-dollar company, within before 2030, but we seem to actually have exceeded that, right? So these companies are now popping up, which is very interesting. There's other like interesting statistics, like the average founder age of AI unicorns has actually dropped like massively. So, like even a couple of years ago, the average age of a founder, like of an AI unicorn was like 40, but now it's like 20, 29, right? Which means that it's, like you got plenty of time to basically like start your own AI unicorn. And we're seeing like all sorts of experiments where people are releasing products that allow you to create a wholly autonomous company, right? Like a company that is just you tell it what to do and it will figure out how to do it. Like we'll figure out how to create the product, figure out how to create the market, or like figure out how to market and sell to customers, and then literally just like, make money based on that company. So very interesting. Secondly, there's a really well-established process for complete beginners to medtech to be really successful at medtech startups. And that's from Stanford University, and that's Biodesign. So we'll talk about that. And then finally, Australians are actually starting to get pretty involved in medtech. Like I said before, Heidi managed to raise at a $1 billion valuation. Like that's kind of one of the first companies that we've seen from the Australian scene. And then secondly, like another Australian company called Eucalyptus, just sold for like a $1.6 billion deal just a couple of months ago. So very, very exciting. And I think like kind of big things are going to happen in Australian medtech. All right, now our teaching goals are the following. So the first is how to balance human and AI judgment in startup decisions, right? So AI still unfortunately can't do everything for you yet. And so the question is like, when should you use AI? When should you not rely on AI? So like kind of understanding that is really important. The second is using AI to substitute human experts in biodesign, right? So when you do biodesign, you have to lean on a lot of human experts, as you'll see, because there's just like a lot of knowledge that is very random that you need to learn, right? But AI actually is really good at replacing those experts. And the reason why that's really important is that those experts cost a lot of money, right? Like it can cost like six figures. I've heard seven figures, sometimes even eight figures, right? Like you're spending like $10 million on these experts. And it's just better if you just learn how to use AI because you can kind of save yourself that much money. And then finally, how to leverage AI to become a 10x medtech startup founder, right? Like how do we kind of get the people who can create like billion-dollar companies because they can kind of hustle to figure it out. Now, like I said, we're going to be super laser focused, right? So by design is something that, historically has taken people like 12 months to learn. If you want more detail, like we are happy to send resources, right? So just feel free to reach out. All right, teaching philosophy. So my job is to create a welcoming environment. If you have any questions, like please ask. Explain concepts clearly, right? That's sometimes like easier said. So if you like don't understand something, like please just like raise your hand and ask. Participant wise, please just bring a beginner's mindset. Like ask questions, like kind of you're here to learn, right? And if you're kind of really interested in this, like please actively support and contribute to the innovation community because I think in Australia it's really small and we have to like help each other to kind of like kind of succeed. Okay, so let's talk about Stanford Biodesign. So this is a methodology that was developed in 1998, and a lot of people are now discovering it around the world, which is really cool. It's a repeatable process for clinical innovation. Okay, so it's a process where like they just basically sat down like the best people in medtech, and they were just like, "What are you doing that's like the same, right?" And they figured out that a lot of people are doing pretty much the same thing, and they're like, "We can turn this into a process." It's a program that converts complete amateurs into experts. So it's pretty cool. So you don't have to know anything about medtech. You don't have to know anything about medicine or engineering. You just have to learn this methodology, which is pretty cool. And in 25 years, it's been pretty successful. They've had a ton of successful companies, raise like a huge amount of money, like kind of $1.2 billion. And yeah, so it's kind of really, really cool. Now, the steps of the by design kind of method are broken into three parts. The first part is focus on the problem. Okay, so kind of crazy, but you have to understand the problem that you want to solve before looking at the solution. And then once you have the problem and the solution set, then you can figure out the startup strategy. Okay, so what's the strategy to actually, deploy this and make sure that everyone wants it, right? So yeah, so very simple. But like I think this is a breath of fresh air for a lot of people who may have been in medtech. Like, we always get requests from clinicians, like or doctors, whoever, and they already have a solution, even though they don't understand the problem, right? And so we're going to make sure that you focus on the problem first, and then the solution, and then the startup strategy. All right. Now we're going to focus on five kind of key things, right? So just what you need to know for this competition. The first is the by design mindset, right? So I'll tell you about what that mindset is. The second is unmet clinical needs. So that is what we call problems in by design, right? So what is the unmet need? So that is something that is, currently unsolved, right? The third is how to do brainstorming. So hopefully you know how to brainstorm a little bit, but there's like some really cool rules that you can apply to make the brainstorming a bit more effective. The fourth is the startup strategy. So this is going to be one of the most kind of in-depth parts because you need to know the different things that we need from you, right? So we need like three things that you need to cover. And so we're going to talk about those three things. And then finally, we're going to teach you how to put it all together. Okay, so say you've done this whole process. How do you put it all together? How do you kind of apply, what rules do you apply to figure it out? Okay, so let's talk about the Biodesign mindset. So this is actually pretty simple, but the kind of mindset that you need to succeed at this case competition is that you're basically moving pieces of a jigsaw puzzle around until it fits. Okay. Now, obviously, the jigsaw puzzles aren't like physical pieces, but they're more like theoretical concepts, right? You need to move around like different pieces of the business strategy or the clinical need or the regulatory strategy and kind of playing around with it until you find something that works. Okay. And that's actually how startup founders succeed because they spend a lot of time on this jigsaw puzzle. They're constantly thinking, okay, like the pieces don't feel quite right yet, right? So I need to change this, or I need to change this, or I need to make this problem smaller or bigger, or I need to change the regulatory strategy here until the kind of puzzle fits, right? So that's the mindset that you need to apply before tomorrow if you want to kind of stand a chance of having a successful strategy. All right, that's it. So that's number one. Number two is unmet clinical needs. So we're going to spend a bit of time on this one. So what exactly is an unmet clinical need, right? So it's basically the problem that the clinician or your patient has, right? So unmet means that it's not currently solved or it's poorly solved. Clinical means that it impacts, patients, doctors, hospitals, and so on, right? And then need is if a solution existed, it would become essential. Okay, so this really most important word is unmet need, right? Which is that it's a need, so people really need the solution, and it's unmet. So current solutions don't really solve the problem. Now, there are 5 parts to an unmet clinical need, okay? And these 5 look very simple, but they are quite complex. Now, when you present tomorrow, we want to hear about each of these 5 parts, okay? And we want to see whether you thought carefully about these 5 parts. And now these 5 parts, actually, we don't need anything long. We actually need just a couple of words for each one, right? Because a couple of words will probably describe exactly what we need to know. So what are the 5 parts? The first is the problem, okay? And this is going to be the main clinical issue. The second is the clinician who's involved, okay? So whoever the doctor, or it might be a nurse, it might be a physical therapist, a physio, whoever is most involved with the problem. The third is the patient. So which exact patient population is most impacted by the problem? And then so we kind of tie these 3 together because if you remember the stakeholder slide, right? This covers the doctor, the patient, as well as what problem that they face. Okay, so we kind of see that as one group. The second group is more to do with the Medicare side of things, right? Because at the end of the day, Medicare is the person who's actually going to pay for these solutions, right? Because the hospital doesn't pay, the doctor doesn't pay, the patient doesn't pay. And so what we need to know is who is the buyer, okay? So the stakeholder that will actually buy the solution. And then finally, what the outcome is that they care about, okay? And this is usually some kind of metric that, for example, a hospital might really, really care about for some reason, okay? And notice how we're untangling stakeholders, right? These first 3 cover the doctor and the patient, and this one covers the buyer, okay? So that's kind of one of the first parts of Biodesign, which is that we talk about different stakeholders in different ways, okay? All right, so let's talk about parts 1 to 3 first, okay? So this is the problem, the clinician, and the patient, okay? So let's try and do one together. Okay, so say that you're a medical student or someone else, you're observing a GP. Okay, the GP gives a referral to a patient with back pain for physio, but they do not attend. Okay, now this usually screams unmet need because there is a problem that if a solution existed, people would really want to, right? Because you will give, referrals to patients, you're trying to make them better, and then they just don't attend, right? And so you're trying to figure out like, how do we solve this? So there are lots of different ways that you can actually think about this problem. Okay, so maybe we'll actually leave this and let's move to the clinician. It seems to be that the clinician involved in this is either the GP or the physio? Okay, it may be the GP, it may be the physio. And the answer is actually you need to dig a bit deeper. Okay, you need to think, are there a lot of GPs giving referrals and they're just not going? Or is it like a specific physio, who's having this issue because maybe they're on holiday? Like what are the kind of reasons why, the problem might land either for the GP or either for the physio? And then finally, the patient here seems to be the patient with back pain. Okay. But a bigger question is, is it just patients with back pain who have this? Is it patients with any kind of pain? Like, what about knee pain? What about like arm pain, forearm pain or something, or shoulder pain, right? Is it a problem that is specific for patients with back pain, right? So you can start to see like there are lots of questions that start popping up, right? And like, at least just for this exercise, just focus on, what's right in front of you, right? Because you're going to see lots of potential problems. But for this one, the kind of simplest one is, all right, patient is someone with back pain. Clinician is, let's say, the GP. And then what exactly is the problem? The problem seems to be that you give a referral and then the patient doesn't attend. Okay. So that would be a pretty good kind of, example of these three being filled out. Okay. Now, I want you to kind of give a try of this, right? So you don't need to go super, super complex, but I want you to practice brainstorming a little bit what different problems might kind of occur in a vignette. Okay. So say you're on hospital wards, right? So you're kind of just observing on a hospital ward. Maybe you have a relative who's on a hospital ward and you see a problem. You see that many elderly patients become delirious because they can't get any sleep. Okay. Now, if you think about that, there's lots of potential reasons why, someone might not be able to get sleep. And so I want you to think about that, right? So I want you to work with maybe the person, on either side of you, just groups of three, and try and get a couple of, you know, versions of this, right? What are different ways that the clinician, like who are we talking about for the clinician? Who are we talking about for the patient? Who are you talking about for the problem? Okay, so I want you to give it a try because this is a skill that you'll need later in the case competition. Okay, so I'll give you a couple of minutes to give this a try. All right, everyone. I hope you had a good chat. So one more minute and then we'll get back to it. All right. Can we hear from a team as to what kind of needs they came up with?
Oh, okay. So the patients have disturbances or they're not adjusted to their environment in the hospital, hence they can't get sleep. And because they can't get sleep, they have downstream health issues like getting delirious. And I'll talk about for the patient's needs first. So obviously the patient is in hospital to get health care and treatment, but also they don't want to be getting worse by not getting sleep and therefore having issues with their well-being, getting delirious, etc.
Yeah.
So for the patient, their needs are to have their health issues identified, getting treated, managed. And for the clinician, the reason why we have these, like, for example, beeping monitors or MET calls, which is disturbing the patients, is because they need to know what's going on with the patient's healthcare and management. So therefore, for the clinician, their needs are ways to manage the patient, know what's going on with the patient, whilst they're not necessarily able to be with that patient all the time in hospital.
Yeah. Thank you very much for sharing. So I think you zoned in on some pretty exciting problems, right? And I don't know if anyone's ever had like, elderly people or even been in the hospital themselves, but it's really hard to get sleep in a hospital. Like I've had to try it once and I'm like, this is the worst, right? Like it's the absolute worst. Um, and yeah, like I think like to kind of show you what Biodesign expects a little bit, right? What we want from the clinician is actually which clinician is involved, right? So it could be that it's like hospital doctors, right? So that would be the like, based on what I heard you say, like that's kind of what you want. So it's not the problem for the clinician, but it's rather like which exact clinician are we talking about, right? And there's a clear reason for this, and I'll go through it kind of in the next slides with this scoping exercise that we always do. But knowing like who you're targeting really matters because at the end of the day, like, once you've created a solution, you now know like who your customer is, from a medical side, right? So this is a really useful kind of exercise. And then for patients, like you said, like it could be elderly patients who are unwell. It could be elderly patients who are on a certain ward, like for example, like on the cardiac ward or some other ward. Could be elderly patients who have diabetes, for some reason that they have sleep issues, or it could be elderly patients who are in a room with someone else. Maybe the fact that someone else is there just makes it really loud, right? And so you kind of want to figure out like what this is, and I'll show you kind of an exercise to do that. So let's just keep it to elderly patients now. So let's say people who are 65 plus. And then what exactly is the problem? And it seems to be that not getting sleep or not getting enough sleep or something like that. So what we kind of want from the case competition is just, it doesn't have to be super long. It's just like, do you know what the problem is? Do you know like who exactly cares about this from a clinical side? And who exactly from a patient side is, the ones being impacted, right? And you see how this is a very elegant way to basically express what the problem, the unmet need actually is. Okay, so Biodesign kind of teaches you to really take out, really hone in on exactly what the problem, the clinician, the patient is, and it doesn't have to be long. Okay. So that's what the kind of stuff we're kind of expecting. Now, you might have also realized kind of through your discussions, and really thank you for the team for that. Is that there's a lot of problem uncertainty or unmet need uncertainty, right? Because it could be a lot of different reasons as to why people can't sleep, right? And the kind of solution to that is, unfortunately, to talk to more stakeholders, right? And you can do this via interviews, you can observe, you can also do research yourself as well. But obviously you can't do this forever. And so you have to make an informed decision at some point. Now, because we don't have stakeholders, right? Because this is a weekend kind of competition, our case will aim to provide enough information so that your team can make a great decision, right? And it is, possible for you to talk to AI to, figure out like parts of the puzzle that you might not know. Okay, so we fully encourage that. Okay, so feel free to talk to AI, like see what kind of parts, what kind of questions you might have in order to really hone in on the need. Okay, so we taught you the problem, the clinician, and the patient. Now, an exercise that almost everyone learns pretty much on their first day of biodesign is something called tree scoping. And I've kind of alluded to it already, but when you have a problem or clinician or patient, you actually don't know if the scope is right. It could be that the scope is smaller, so that is, it impacts a smaller subset of patients or smaller subset of clinicians, or it might also be larger as well, right? So it could, for example, impact more clinicians, more patients, be a bigger problem than you imagined, or a smaller problem, right? So you actually do this exercise just to get a feel for what's right, okay? And I'll kind of run through an example so you can get a feel of that. So what we use, sorry, before I move on, is this tree, right? So you can actually draw this tree. We're hoping you'd have whiteboards for this, but that's okay. Like you can just kind of do it in your head. And what you basically have is some initial version of your guess as to the problem, the clinician, or the patient. And then you try a narrower version, you try a broader version, and then you try a parallel version. Okay, so what on earth does that mean? So let's talk about the problem that we just discussed. So the ward is too loud at night, the clinician is hospital doctors, and the patient are elderly patients who are 65 plus. We put the ward is too loud at night, so our initial version here on the tree. And then we try describing the problem in a more narrow way. So for example, the ward is too loud at night. One of the reasons why that might be the case is that another patient watches TV at night. Okay. And then what is a broader version of that? Well, the ward does not support sleep in general. So you see how this is a more general version of this, and this is a more specific version of this. Okay, so I kind of let you maybe process that a little bit, right? Because this is a really kind of important exercise that all biodesign people do. So I'll just repeat it again. So you have the initial problem that you thought of here on the tree. And then the exercise is you need to brainstorm or figure out a narrower version of the problem. So a specific reason why the ward might be too loud at night. And then from there, you go broader. So what is the broader way to describe this? So too loud is a specific reason that the ward does not support sleep. It could be, for example, that it's actually too bright at night as well. So you see how this is kind of like a parallel version of this, right? So on one hand, we're focusing on sound here. And then on another, we're focusing on how it looks at night. That is, it's just too bright. You know what I mean? Like, you can't sleep because it's just too bright. And so you see how this exercise is really important because it forces us to think of other reasons why the ward might be too loud at night through this. And it also forces us to think of other reasons that we might have missed as well, right? Because if we hone in on the ward is too loud at night, it could be that it's actually too bright and the solution are eye masks, right? Rather than earplugs, okay? So it's a very useful exercise. And yeah, like scoping is going to be something that we want you to get good at because one of the biggest questions for any kind of startup is, do you have the right scope? Are you working on the right problem? Should it be a bigger problem or should it be a smaller problem? And what are the reasons for that, right? And the same question is also asked of the clinician and the patient. Are you targeting the right set of doctors? Or should you be targeting on more specific doctors? Or should you be targeting a broader doctor or clinician population, right? And then for patients, are you targeting the right patients? Should you have a broader set of patients or a narrower set of patients? And there's a kind of business trade-off to it, right? Because if you focus on a very narrow set of patients, then or clinicians or a very narrow problem, then everyone who has that problem is going to absolutely love you, but then you're not going to make enough money, right? But if it's too broad, then you might make money, but it might be too broad that no one really cares about your solution, right? So it's kind of getting that balance right, right? Like we call it the Goldilocks feeling or zone, right? Which is that you actually have the right scope for the problem, the clinician, and the patient, okay? So let's do another kind of version of this so you can kind of get a sense of it. So our initial guess for clinician is hospital doctors. So what is a narrower version of that? It's going to be geriatricians. So geriatricians, for those of you who don't know, are specialists in elderly patients, okay? Because if you recall the vignette, we were talking about elderly patients. So it could be that the clinicians who are very excited by your solution are people who specialize in the elderly, okay? A broader version of that is maybe it doesn't just impact hospital doctors, but it impacts all hospital clinicians, right? So like nurses, physios, like occupational therapists, maybe they all care about this problem. You need to ask if that's the case. And what is a parallel version of hospital doctors? Well, it's hospital nurses. Nurses are actually the people who care most about patient sleep, and it isn't doctors. And so this is one way to say that, realize that nurses are really important in this problem. Okay, so very useful exercise. And then a kind of final version of it, so elderly patients being the kind of initial patient population that we guessed. The narrower version of that is elderly patients with dementia. Like it's widely known, and there's lots of research about this, that if you're elderly and you have dementia, and then you go into a hospital, you're very, very likely to become delirious and kind of lose your wits because you can't sleep. Okay. And so you see how it forces you to kind of clarify like what specific population might benefit most from this. And it could be that instead of targeting all elderly patients, like that's really hard in a hospital, as you can imagine, you actually just target those with dementia so that every time someone comes in with dementia, you treat them, right? And you see how it's much more targeted, much more honed. The broader version of that is all hospital patients. You know, maybe it's a 55-year-old who can't sleep, or maybe it's a 25-year-old who can't sleep, right? Um, then a kind of parallel version of that I can think of is like pregnant mothers. Maybe pregnant mothers really want their sleep, and it's really important for them to get sleep. So you see how it kind of forces you to just think about different ways that you can frame this problem, right? And it's a very useful exercise that is really at the heart of biodesign. So let's kind of let's try and do one together, right? So the tree that I provided here is a simplified tree, but we want you to kind of brainstorm in a much more, I guess, like a much more complex way, or kind of bigger way, right? So say for example we have this problem, clinician and patient. So the problem is hospital infections, a very common problem. The clinician are surgeons, okay? So hospital infections are commonly tied to surgical procedures, right? So after you have a surgery, unfortunately, it's quite common to get an infection. And then the patient that we're targeting is post-abdominal surgery. So patients who've just had surgery on their abdomen, okay? So their belly, their stomach. That is a very big area, as you can imagine. It's a huge kind of area. And so it's really easy to get a surgical infection. And so the way that I would do this kind of scoping exercise is I would start with surgeons here. And then I go, okay, surgeons is pretty big, right? It's just a huge kind of number of clinicians. And so let's go more specific. And that's going to be gastroenterology surgeons, right? GI, gastrointestinal tract surgeons, like surgeons who specialize in the stomach, the bowel, that kind of stuff. And then you can even go even narrower, right? So this is still a pretty big population. So maybe there's like a more specific type of surgeon that I want to target, right? So maybe it's early career surgeons because they're just out of training, right? Maybe infections happen a lot in them. Or maybe it's like rural surgeons, right? Because they don't have as much support as urban surgeons. And so maybe they have really high infection rates. Or it's surgeons with more than 100 procedures per week, right? They just do a lot of procedures. This number doesn't even make sense, but like they just do a lot of procedures, and so they get a lot of infections, right? And so this is where you have to kind of look at research, talk to AI, like Google stuff, right? In order to figure out like what kind of surgeons get the most infections, like they kind of have the highest infection rate, right? And this is where you kind of like need to start to narrow down, right? Because the kind of worst thing is a startup that says that they want to target all surgeons, because that's just impossible, right? Like it's not possible to target every surgery procedure possible. And you never have enough money to just target everything all at once, right? You have to be very targeted and go, okay, this specific procedure is the problem that a lot of hospitals face, and we're going to target that first and then expand to like this second procedure and then this third procedure, right? And that's kind of the focus that you want to have, right? When you're doing a startup or when you're doing the case competition. And then, parallel versions, maybe there's just procedural doctors or day surgery doctors. So it's just an exercise to kind of get you thinking, okay? So I want you to give this a try. okay? Because the kind of best way to practice this is just to give it a try. And I'm going to give you maybe like 5, 10 minutes. Just go back to your teams, right? And I want you to try doing this exercise for the problem and if you have time for the patient, okay? So just give this a try because you're going to do it, in a couple of hours anyway, under kind of more stressful conditions. And so yeah, give it a try now. Just practice doing this and seeing if you can kind of increase the scope, decrease the scope as you wish, right? And get a feel for like what feels right, right? This is kind of a really subjective thing as to like, oh, that's just too broad, like, is it really realistic? We're going to target every surgeon or every patient with abdominal surgeries. Yeah, so give it a try and I'll give you a couple, around 5 or 10 minutes for this. All right. Should we get a team to share something that they tried?
Yeah, so we'll think about the problems and how the hospital infections, if we're thinking narrower, could be like the type of infection or the reason for it. So like it could be a specific type of infection, like a specific bacteria or a
Mhm.
virus,
Yep.
or it could be like why they got it, immunocompromised because of
Yep.
specific drugs or antibiotics and stuff like that, which, they will probably have to use, especially like painkillers and stuff, if that's causing anything
Yep.
because there can be a lot of complications and that ties into how we can get broader. So other complications that can happen after surgery,
Yep.
and that feeds into your parallel versions as well. So maybe
Yep.
internal bleeding after the surgery, maybe on kind of like random inflammation or something, and then something else went wrong. Maybe
Yep.
the bowel movements stop and like how we can fix that. So we'll just think about the problem and how we can branch out from there.
Perfect. Yeah, that was actually a perfect answer, I think. Yeah, like the narrow forces you to think of like different specific reasons, right? And like, can you solve that specific reason? The broader forces you to think more broadly, like just in case you're thinking too narrow. And then the parallel just goes like, can we treat pain instead? Can we treat like this other thing instead, right? And so that's, yeah, as you can see, like hopefully it's a really useful exercise so that it just forces you to brainstorm, right? Because, we have so many clinicians come in and they just already have a very specific problem they want to solve, but it's super easy to just go, well, have you thought broader? Have you thought parallel? Have you thought narrow, right? Like, and what's the kind of implications of that, right? And it's super easy. And hopefully that's a skill that you all develop during this case competition, which is when someone comes in with a problem, you just go, well, have you thought about like these other versions of it, right? And that actually might be more valuable, right? And yeah, we'll show you some kind of examples of how people have done this in the real world and actually built successful companies as well. So that will be coming up. So thank you very much to that team. Okay, just to kind of close out the tree scoping part, you just basically do it for the problem, the clinician, and the patient. And then you just will realize that at different parts of the tree is kind of what feels right. Okay. And like I said, that's a really subjective thing. So, talk to Isabella, Mark, and James about this, right? Because they have a kind of like hopefully better sense of like what that is. And yeah, like you just want to develop that feel of like what feels right for the problem, like you kind of develop this lens of, well, that problem is too big for one team to solve, or that problem is too narrow, right? And so you need to go bigger. Okay, so feel free to ask any questions. I'm just going to keep moving on in the interest of time, but I'll keep an eye on any questions. So please just send any in. Okay, let's talk about parts 4 and 5. Okay. Now, this talks, if you recall, about the buyer. So, who's actually going to buy your solution, right? Because the doctor's not going to buy it and the patient is not going to buy it, right? So, usually it's like the hospital or the clinic, or sometimes even the government, right? So, this is the person who will buy it. You need to identify that as early on as possible, because you want to make sure that they're actually going to buy it. And then the second thing is the outcome. So the outcome that the buyer actually cares about, right? So this is usually some kind of quantifiable metric, right? And I'll give you some examples of that the buyer really cares about for some reason. Okay. Now, just before we move on, these parts here are usually what people know the worst, right? So when I ask someone to describe the need, they have no idea who's going to buy it and they have no idea why the person would buy it, which to me sounds, like it sounds really silly when you say it, but clinicians actually like rarely know this. And so hopefully it's something useful for you to learn about because the rules themselves are actually really, really simple. So the buyer is the person who's actually going to buy the solution. And this usually depends on the setting of care. Okay, super simple rules. So if, for example, you're treating a patient in a hospital, usually the hospital will be the buyer. Okay. If you're treating a patient in a clinic, usually it's the clinic that's going to buy it. If you're treating the patient out in the community, so not in a clinic or not in a hospital, then usually it's the patient who has to buy it. Okay. And then finally, if it's like a public health problem, that like no one really wants to buy or deal with, then the government will purchase it. Okay. So again, very simple rules. It just depends on the setting of care. Now, the outcome is something that needs to be usually quite quantifiable so they can track like how much your device or your drug or whatever is improving things. And it usually is highly visible. Okay, so that is, exec are aware of it, they'll talk about it in like press releases, that kind of stuff, right? For hospitals, you want to look at their KPIs. Okay, so for those of you who don't know what KPIs are, these are key performance indicators, and it's usually how execs like performance is measured. Okay, and sometimes these might be department specific as well. So for example, if you're solving like a really specific problem in epilepsy, the hospital is not going to have a KPI for that, right? But the department might. Okay. Unfortunately, these KPIs are just widely accessible online. So, for example, you can search like Monash Health KPIs, and they actually publish a huge report on their KPIs, right? So it's not something that's like supposed to be hidden, not supposed to be something, you know what I mean? Like you can just simply point to a KPI and be like, we're improving that. And then they'll strongly consider whatever it is you're selling to them because they want to improve those KPIs. Okay. So that's for hospitals. For clinics, it's usually profit or efficiency related because at the end of the day, clinics are small businesses. Okay, you got to make a profit. You got to like improve how much money and how much staff you're paying, right? And so what you're looking for is profit, okay, or efficiency. That is, you're saving someone time and saving someone money. For patients, this may be intangible, right? So as you can imagine, if you've ever been a patient, sometimes you just want to feel better, right? Like, so it's just like, does buying this thing make me feel better, right? That's often hard to measure, right? But it's really important. Like, for example, if you have back pain, you just want that pain to go away. You're gonna pay for something where the pain is gonna make, go away, right? And so that's what patients care about. So you kind of just put yourselves in people's shoes and you're like, if I have back pain, like what do I want, right? I want it to go away, right? So my thing has to make the back pain go away. Sometimes it might also be about time or money saved, right? So it could be that, uh, say you have like cancer or something, and it takes a long time to manage all your clinic appointments, right? But I'm willing to pay like, $50 a month so that someone manages that time for me. Like I'm gonna do that, right? And so just think about like, put yourself in people's shoes. For the government, also look at their KPIs as well. So again, government bodies are like hospitals. They publish the KPIs widely. You can figure out what they want and what incentives they have to buy your thing. All right, I'm seeing a bunch of questions come in, but I'll cover it after we finish this section. Okay, so let's try and do one together. Okay, so again, this is not supposed to be complicated, right? So let's say that we had the problem of deep infections, right? So infections which are really deep in the body, right? So not like at the skin level, but like organ level infections. The clinician we have is GI surgeons, so surgeons who specialize on the stomach or the bowel. And the patient is GI like cancerous section. So that is bowel cancer, stomach cancer, like removing that. Now, the buyer for this hopefully is obvious. Okay. So this obviously has to be in a hospital that you'd be doing this major surgery. And so the buyer is going to be the hospital. Maybe I'll just write this down. So buyer is going to be the hospital. And then the outcome. So what I actually do for this one is I just put something in like Monash Health KPIs. And then I've already clicked on this before, but they have a giant report about all their KPIs. Okay. And you can just basically search something like hospital infection. And you'll see that they have a KPI on hospital associated infections, right? And so what you're going to do is basically decrease the rate of hospital acquired infections like that. Okay, so again, very, very simple, right? But this is kind of just like a sanity check to make sure that there is actually someone who's going to buy it and they have an outcome that they are willing to, buy for or care about, right? So again, not supposed to be complicated, but this is where a lot of unmet needs will fail. Okay, you'll realize that there actually isn't a buyer and there is no outcome that they're willing to pay for, in which case you actually just kill the project at this stage, but it's taking you about 5 minutes to get to this stage, right? All right, so I want you to give this one a try because this one is actually a little bit trickier, but a Biodesign team at Stanford managed to figure this out and actually create a company, and it sold for like 80 million or something, right? So you can see like kind of the insights that you can have at this level can be absolutely critical to the success of your startup, right? So I'm going to give you a couple of minutes just to discuss this. Doesn't need to be long. There's a couple of options, but I want you to kind of navigate that because that's a skill we need you to have for the case competition. Awesome. So, do we have a team?
Yeah. We said that the buyer could have been either the patient or a clinic,
Yep.
and then we said the outcome is probably to prevent unwanted pregnancy or just help people stay protected when they're being sexually active.
Yep. So, I think this is kind of like the key question that people actually couldn't crack without the by design framework, right? Do you think the clinic is going to care about this?
Maybe not, but it could potentially, you know, it could ease their communication with patients, or it could help them with their efficiency because, it could be quite tedious explaining to a patient what to do if they miss the pill, but it probably has a bigger patient application.
Yeah, that's correct. Yeah, so you're kind of right there. And keep in mind that clinics care about profit a little bit. So if they come back for more pregnancies, then you actually have more appointments, right? So it's actually not necessarily from a financial standpoint, you actually might make more money if they have an unwanted pregnancy as well. So it's kind of shaky for a clinic, as you can see, right? It doesn't really tie into what they want. And so the kind of realization that this startup team had was that they initially put clinics, but they were like, there's no reason why clinics would care about this. And so the answer is that the buyer has to be the patient, right? Because patients will pay so that they have less missed pills or lower risk of pregnancy. Okay. So you see how, like, even with just such a simple framework, you can have fairly important insights very, very early on. You know what I mean? Like we've just been teaching you for like an hour or an hour and a half or something, right? And already you can start to see and break apart different problems, right? When people come to you, you can just be like, who's the buyer? Like, what's the outcome? And if that doesn't really hold water, then you know already that project might be doomed or might need some pivoting, so that you can figure it out, right? And that's kind of part of the buy design process. And we want to kind of drill into you, which is that we want the kind of easiest way to realize problems with projects and then be able to pivot very, very quickly. Okay. And that's kind of the skill in the case competition because we're going to need you to pivot a lot of times, right? In order to find the right optimal project. And like I said, by design is all about moving the puzzle pieces together until it works. Okay. Now, I want you to, again, just spend a minute or so thinking about what the problem with this one is. Okay. Actually, I might not even give you a minute. Just have a read through and try and get in your head what you feel like the problem might be with something like this. Okay. So yeah, take a look. Okay. Try and lock in a kind of diagnosis for what's wrong with this, right? And then just see if you're correct. And that's okay if you're not, because it's kind of like a learning opportunity. The problem with this, for someone who's trained in biodesign, is that most of these are too broad. Okay, so it's kind of a scoping issue. Okay, surgeons, like which kind of surgeon? You know what I mean? Like there's like 20 different types of surgeons, right? Do you get pain after every surgery? Not necessarily, right? Like you might have a surgery that is really deep and you only get pain kind of at the skin level, but not really anything beyond that, right? Um, and so the kind of realization with this one is that tree scoping needs to be used so that you narrow down the problem that you're working on. Okay. So for example, like a problem that might be really valuable for this is joint pain because joint pain is really, really severe after major orthopedic surgery. Okay. So that's a surgery on like the knee, the shoulder, like the shoulder is really, really painful after shoulder surgeries. And so this is not stuff that, what I mean, like is rocket science. You just need to look this up, right? Like after a surgery, like who has the most pain, right? It's going to be orthopedic surgeries, okay? And so this kind of realization here is really important for scoping, right? Because you have a lot of people look at this project and be like, this just feels too broad, right? Like there's no way you can solve all of this for all patients, right? And so narrowing down on the most kind of valuable market is going to be a critical skill. All right. Now, this is another problem that, again, another team at Stanford actually managed to figure out. And this problem or the diagnosis is a lot more subtle. So I'm actually going to give you a couple of minutes to figure this one out. And I want to see if like anyone can actually realize it. The team that realized this managed to sell the company for like $780 million. So like, again, like just having these basic skills and trying to diagnose the problem with this can be very, very valuable, right? So see if you can find out the problem in this one. So I'll give you a couple of minutes.
Oh, yeah, it works.
Okay.
So the problem we saw was first off, you need to kind of define a more specific problem. So like, what kind of surgery was it? Was it because they put something in their nose, or was there like a structural defect, or was there like an injury that caused obstruction? So yeah, the problem's too kind of broad. Second thing is, yeah, the problem and the patient use is too broad. And then if you had a more specific problem and patient, the outcome would be easier to define. So let's say it was just like they put something in their nose, right? So the KPI could be recurrence of like infection or something like that, or like injury, looking at that, or like if it was like a structural issue, you could check like a 3 month and 6 month and a year like follow up and see if they get any follow issues with it. So like what would it, I don't know,
Yeah,
like infection or like just another injury.
awesome. Yeah, thank you for that. I think you've almost got it actually. You're kind of like dancing around the issue a little bit. So kind of for context, right? When you have a nasal obstruction, so that is your nose kind of looks like this, right? Like it's not a very pleasant kind of thing to have. Um, Historically, you'd always have to go to a hospital for major surgery. Like it was considered a major surgery, right? And what this team kind of realized was that there is a big problem here in particular, right? The buyer are hospitals, right? Because you have to get treated in a hospital, right? Because it's a major surgery. But they didn't really have any clear KPIs about this, right? Like the ENT department, kind of like the ear, nose, and throat department, kind of had, they care a little bit about nasal obstruction, but didn't care that much, right? And so what the team realized is that they should shift it away from hospitals and towards clinics. Now, why is that? Because clinics are profit motivated, right? And so they want to increase procedural volume because that brings them more profit, right? Like you just do 10 surgeries, you get paid for 10 surgeries. If you do 20 surgeries, then you double your profit, right? And what they realize is that instead of hospitals or specialists always doing it, it could also be GPs as well. And so the problem they realize is that treatments are specialist only, right? And very rigorous and onerous, right? And so they actually shifted this procedure instead of a major procedure into the clinic. And then the way that they figured out how to do that was basically through a very old technique that is common in cardiology, actually, which is that when you have, clogged arteries, right? Your artery is just full of fat, basically. You can put a balloon in there and expand it, okay? And it will just basically expand the vessel, and that's it. And they realized that the nose is the same, right? You could basically just insert a balloon into the nose, expand it, and then you get rid of your obstruction. And so they created this very simple device. It looks like a bicycle pump, basically, right? And that managed to net them like $780 million because Medtronic eventually bought it after about five to 7 years. So you see how even at this level, they're getting insights that are absolutely critical for designing this. Because when you look at something like this, the kind of solutions you think of are going to be like major surgeries. But if you realize that you need to shift to the clinic to align with the outcome, then that's actually when, you can create something very simple like a bicycle pump thing and just basically solve the nasal obstruction inside the clinic and shift it entirely outside the hospital. Okay. So like I said, realizations at this stage can be absolutely huge. Okay. All right. Now we'll cover the questions actually. So feel free to just send through any questions and I'll take a look at them. So these are the questions we have. How would one determine at which point they have conducted enough scoping? That's a great question. I actually don't know the answers to that. Some people spend like 3 months, some people spend like 12 months doing this. Actually, like the answer is that when you do a startup, you never stop scoping. You always continuously ask, like, have I got the right scope? How can I improve my scope or my understanding of the scope? Okay, so this unfortunately never ends. Um, Fair to say buyer categories overlap, e.g., hospital buys, but then there's reimbursement, so government and insurer will eventually pay. Yep. Can you assume that if there is a form of reimbursement, then a hospital clinic would pay? This is a great question. We're actually going to cover reimbursement strategy, later. But essentially, like what this question's talking about is that when a hospital buys something, they expect Medicare to pay the hospital back. Okay, so say I go and I do a major surgery, right? And I use a bunch of tools and it cost me like $2,000. They expect Medicare to pay them back like $3,000, for the effort as well, right? And so when that reimbursement doesn't exist, so we call that reimbursement, so Medicare reimburses you. If that reimbursement doesn't exist, then hospitals actually don't buy it because they're going to be $2,000 out of pocket, right? And so they actually don't buy anything unless reimbursement exists. And so that is actually one of the most important things. If Medicare doesn't pay for it, like no one's going to buy it. And that's going to be the one of the things that will teach you the check. All right, and then the next question. Wouldn't the buyer be insurance for most things for hospitals? So the insurance is actually the payer. So they pay for things, but they don't buy things, right? Like Medicare doesn't go around buying things. And so the buyers are almost always the hospital or clinic, right? Like they're the person who actually has to buy the thing and then they get reimbursed, but they are the person who decides what to buy and they have to contact the suppliers and like Medtronic and that kind of thing. How would you get around to making the product billable? Yeah, we're going to talk about this process. Unfortunately, for devices and software, sorry, devices in particular, it takes about 6 years after you launch in the market to get Medicare coverage, which is why that you usually want to find and see if you can get a reimbursement that already exists. So we'll talk about that later. Great questions. All right, let's keep moving. All right, so that is unmet clinical needs. Okay, so that is the bare bones of what you need to know. We spent like 12 weeks on this when I was at Stanford, but we've covered it in an hour and a half, so hopefully that was kind of efficient. So after you have a problem, the next thing to do is to brainstorm a solution. Okay, now I'm not going to teach you how to brainstorm again, but there's a couple of rules that are really good for brainstorming. So the first one is deferring judgment. So if someone comes up with a wild idea, like please do not judge their idea, because wild ideas actually usually have some kind of like element of truth, right? So when I do brainstorms, I always tell people like, give me the wildest idea you can think of. Maybe it's like a dinosaur comes in and it like puts its like claw up your nose and then it like, fixes your nasal obstruction somehow, right? You want to build on the ideas of others. So there's no silly ideas. You want to see like, what if we bring that idea to its conclusion, right? Go for quantity, have fun. Okay. And there's lots of different ways that we actually brainstorm from a medtech perspective. And these are 5 of the most useful ones that I found, right? The first is to think about the mechanism of action. Okay. So, for example, different ways the solution could work. So, let's just talk about the problem of obesity. Okay. So, different ways that you can improve obesity or kind of solve obesity is, for example, to increase your energy, right? Like if you exercise more, then you're going to kind of lose energy, right? You're going to lose weight. The second is to reduce food intake. Like if you just stop eating, then you basically will improve obesity. You could reduce the motivation to eat. You could reduce food absorption. There's lots of different mechanisms that you can use. Okay. The second is to think about the anatomy. Okay. And this is going to come more naturally to those of you who are medically trained. And I think every team has people who are medically trained or like in med school. And you can just think about different locations or different places the solution could target. So say we're talking about obesity, maybe you can target the stomach, maybe you can target the small bowel or the large bowel. Okay. You can target like kind of different areas or the mouth. Um, the third is engineering discipline. So this is where the engineers will have kind of an advantage, right? But think about different types of engineering. Could you have a chemical solution, an electrical solution, a mechanical solution, a digital solution? Clinical journey. So back to kind of the medical side. Think about different points in the clinical journey. Okay, so could you prevent obesity from childhood? Could you prevent obesity when they're like a young adult? Or could you prevent obesity, when they're middle age, right? Could you prevent obesity like before they have surgery or after they have surgery? Okay. This is the old way to kind of deal with obesity before Ozempic and that kind of stuff was to actually reduce the size of the stomach surgically, which is a very archaic procedure, but we kind of just did it like 5 years ago. And then the final category is wacky ideas. Like what if people stopped eating food altogether? What if everyone was on a hamster wheel? Like what are kind of just crazy ideas you can think of? So I'm gonna get you to practice your brainstorming muscles, right? And I call these muscles just because the more you brainstorm, the better you get at it, right? Like thinking of wacky, wacky ideas, right? And so I'm just gonna give you a couple of minutes to just discuss crazy ideas or random ideas and practice each one. Okay, so try like different ideas for mechanism of action, try different ideas for anatomy, right? Try different ideas for engineering discipline and clinical journey, as well as wacky stuff. And this is the problem or the unmet need that you're going to work on. Okay. So I'll give you maybe about 5 to 7 minutes for this. And yeah, give it a try and have fun. All right. Awesome. Can we hear from a team? So hopefully you've had a bit of a brainstorming thing, but you're going to do this plenty in the case competition. But love to hear like what people thought of. Like I'd love to hear the wacky ideas actually.
Scientist.
Hello?
Hi, Clark, can you hear
Yeah.
me?
Yeah, I can hear.
For wacky idea, I'll throw something out there. Uh, how about maybe skirting the issue altogether, but how about people just don't have physical sex? So maybe that means like you
Yeah.
move to like a digital health sex environment as well, and then you skirt this entire issue entirely. Like maybe with VR or something to affect that.
Yeah. Okay. Yeah. Awesome. What
Yeah,
else?
guys.
Yes, so because we have talked through about from anatomic location, which
Yep.
everyone knows is we can solve the problem from engineering this by chemical. There's already a solutions where you put chemical in the woman's bloodline and it will gradually diffuse the chemicals. So you don't have to take pills anymore.
Yep.
Or chemically, you can put a small ring inside the human's body, and it will stop the sperms to getting inside.
Yep.
But we thought it's a little bit boring, so we have more ideas for wacky ideas.
Yeah.
We want to like when people have period, we just freeze all their eggs. And we can also freeze sperms, and then everyone is sex. No one is able
Okay.
to have a child from physical sex, and everyone have to do IVF if you want a child.
Right. Yeah. Okay. Interesting. Okay. Interesting solutions. I suppose I hadn't thought of some of these, but like the kind of wackiness. What you kind of want from these wacky ideas is like what is the kernel of like the real solution, right? Because obviously some of these ideas like they're just not plausible, right? But it's like what is the kind of truth, right, that you're trying to get at? So yeah, thanks for sharing your wacky ideas. Um, Now, after brainstorming, what you want to do is essentially group your ideas into clusters, right? So you're trying to look for themes, basically. Like maybe, after like five of these ideas are the same thing, like so you want to group that. And then what we usually recommend doing is everyone gets to select their favorite ideas, and you get to select the top three, okay? And you can just mark it, like one, two, three, and then you just see like how the group has kind of spread, and then you can kind of discuss to see which solutions may be best. You don't want to throw away any of the solutions. As you see, when you kind of go through the final part of the by design process, that usually invalidates a lot of solutions. So you want to go back to your brainstorm and go, actually, maybe this solution works better. Okay. So, you're going to have lots of solutions kind of pretty much almost till, the end of today, probably when you go, okay, like this solution may be the best one. All right. Now we're on to kind of stage four, which is the startup strategy. Now, everything that we've covered up until this point is something that you should aim to learn how to do manually. Now, AI can help you, but it actually isn't as good as humans who have been trained to do this. Like I don't know, I've asked AI to brainstorm stuff, and the solutions are just wacky, right? Like it's just not really good at brainstorming. Like unless it's something very obvious, usually. In terms of like figuring out unmet clinical needs, again, I've tried this with AI and it just misses the problem. Do you know what I mean? Like it's not very good at like diagnosing the problem in unmet clinical needs. And so these are actually skills that we want you to develop by yourself because we don't think that AI is good enough in order to do so. And the first part of the case competition, and we'll talk about this later, is actually a no AI period. So we're going to get you to do the unmet clinical need and the solution brainstorming like without AI at all. Like no laptops, no tech, no phones, nothing, right? And then you're going to submit like your best guess at this. And then after that, like AI is fair game, right? And AI is going to be absolutely critical for this section here because this is the section where you need to rely a lot on experts. And so we're just going to give you a really, really high level version of this, right? So don't be stressed if you don't understand all of it. And feel free to ask questions, okay? I want you to kind of at least get the basics of it, good enough so that you can talk to an AI and know what it's talking back to you about, right? Like, so you can understand what is happening. If there's something that you don't understand, then you're welcome to ask AI to explain more simply to you, okay? But As you'll see in the program, the platform that we've built, you actually have to choose which expert you're talking to as well. And so you need to know that, well, that problem you're thinking about is an IP problem, like intellectual property, or that problem you're thinking about is a regulatory problem, right? So we just need you to know kind of like the really high level basics of this startup strategy. And at Biodesign, this is what they spend like 6 months on, right? And so please don't be alarmed if you're just looking at this and you're like, I didn't understand any of that, right? Go back, take a look, try to make sure you understand what the key question is and what the key deliverable is for this. And then finally, we'll talk about putting it all together. Okay, startup strategy. So this is actually what most startups will spend the vast majority of their time on. So after they figured out the problem, the solution, that generally takes about like 6 months historically, but I think it's faster now. They have to figure out what the startup strategy is. And if there's anything that fails in any of these domains, then you have to go back to the drawing board. Okay, so that's kind of the rules of Biodesign. If you fail here, then you have to iterate on either your problem or your solution. Okay, so this is unfortunately not a linear process. You basically do this like 50 times, but you'll have a problem, you have a solution, you get here and you realize it doesn't work. So now you have to fix your solution or fix your problem, and you constantly are iterating along this chain. Okay, so let's talk about startup strategy. There are three main domains. Okay, the first is regulatory and clinical, and I'll explain what those mean. The second is technical and IP. And then the third is business and reimbursement. Okay. And as you can imagine, these are kind of like the three domains of medtech in general. So you have the medical one, so like what doctors are usually in charge of. Technical and IP is usually the responsibility of engineers. And then business and reimbursement is usually the responsibility of the business person. Okay. Now, I want you to kind of get good at all of these, right? I know some of you may be engineers, you'll be particularly good at this, but I want you to kind of develop how to think about this as well and to kind of get a sense for what works from a business side, okay? If you're clinical, you're going to probably be good at this, but I want you to get a sense for what works and what doesn't work from an engineering side and what works and what doesn't work from a business side, okay? And fortunately, all of these follow pretty specific rules, right? So that's what we've actually trained the AI on, right? Like just to basically regurgitate these rules back to you. But you want a good sense as to each kind of component of these domains. Okay, so let's talk about the first domain. So that's regulatory and clinical strategy. Now, recall that medtech is a regulated field, right? So the kind of key goal of doing all of this is getting regulatory approval. Okay, so that is getting permission from the FDA or the TGA to sell your product on the market. Okay, and so the very first question that we always ask is, what is the regulatory pathway? And I'll show you what the different pathways are. And then based on that, you need to decide how many clinical trials you need to run. So how the FDA or the TGA work is that they look at your device and they go, well, you need to show us evidence that it works in a human, that it's actually safe. Okay. So you can imagine for a pacemaker, they had to do clinical trials, right, in order to get regulatory approval. And so the key questions is, how many trials do you need to do? And how expensive is this? Because as a startup, your biggest expense is running a clinical trial. The goal of this section is to select the lowest regulatory class possible. Now, sometimes this may not be possible, and there is a financial trade-off, right? So if, for example, you go with a regulatory pathway that's very difficult, you usually stand to make a huge amount of money. While you go with one that's a lot simpler, the amount of profit that you make will be less, okay? So there is kind of no good or bad about how complex this is. It depends on, how much money you're making and how complex this pathway is. All right, the second part is the engineering component. So that's the technical and the IP parts. The technical strategy is, how much will it cost to build your invention? Okay, so some inventions are very easy. Like it just costs, maybe like, I don't know, like 10K, 50K, 100K to build, right? And some, unfortunately, are very complex and they will cost you $10 million or $100 million or even several billion to build. Okay, and so you want to figure out how much it will cost. And then intellectual property. So for those of you who don't know, this is patents, to protect your invention so that other people can't copy you. And the question is, can you protect your invention with a patent? Okay, so we'll talk about what that means. And the goal is to find the novelty sweet spot, because there's essentially this trade-off. if your solution is too novel, it's going to be like ultra expensive to build, okay? But it's going to be very protectable with a patent. But if your solution is not very novel, then it will be very cheap to build your invention, which is good, but you can't protect it with a patent. So everyone can copy you, okay? So we'll talk about this novelty sweet spot. Then the final domain is the business domain, okay? And the questions here is what's your business model? So how are you going to make money, right? And I'll show you how to do that. And then what's the market size, okay? Like how big is this market that you actually intend to target? And then this also includes reimbursement strategy. And that was what I was talking about before, which is Medicare actually going to pay for this, okay? And the goal in this case is to maximize realistic revenue. Now, with these three domains, each required years to learn previously, or an expert costs quite a lot of money. But for this section, you will use AI agents to help you. Okay, so please don't be worried if there's a lot of detail in this section because AI is going to help you with this in particular. Okay. Now, a kind of note here, although we're all Australian, we are going to focus only on the US market because for medtech companies, the US market is unfortunately the only one that really matters financially, as well as just by size, right? So whenever you do a medtech startup, people will always ask you about what your US market strategy is. Unfortunately, if you focus just on the Australian market, like most people aren't as interested. And so it's a really critical skill that you understand how to scale in the US in particular. All right, so let's talk about each one in turn. So we're talking about the clinical part first, and then the engineering part, and then the business part. So, regulatory strategy. The key question that we want you to answer for the case competition is what is the regulatory pathway? Just a single question, okay? And these are the options that you have, okay? So for devices and software, the answer can be class 1, class 2 510K, class 2 de novo, or class 3. For drugs, unfortunately, there's one option and it's new drug application, okay? So how does this work for devices and software? When the FDA receive an application, they will stratify it based on the risk to the patient. Okay, so if, for example, it is a low-risk device, then it is considered a class 1. So an example of a class 1 device are Band-Aids. Okay, it's really difficult to kill a patient with a Band-Aid, and so it's considered a low-risk device. Okay. Now, on the other side of the spectrum, there are class 3 devices, and these are high-risk devices. So, for example, pacemakers. If you screw up any part of your pacemaker, then you will probably kill the patient. Okay, so these are considered the highest risk devices. And then in the middle are two classes of medium risk devices, which is really interesting, right? I don't know why they called it 1, 2, 3 instead of just 1, 2, 3, 4, right? But just historically, they've divided class 2 into two types. The first type is a 510K, and this is when similar devices exist. Okay, so how the FDA works is that they say, this device is definitely medium risk, but similar devices have been proven before. So therefore, we're going to make it easier for you to get regulatory approval. And I think that is very reasonable, right? So an example of this is an ultrasound machine, right? So ultrasound machines are medium risk because they can sometimes go wrong very quickly, right? But similar devices exist. Like we know that ultrasound machines have been made for like 50 years, right? And so therefore, we don't need to make it ultra difficult for someone with a new ultrasound device to get regulatory approval. So a very cool kind of process. This process is actually unique to the US and doesn't exist in Australia or Europe, okay? Now, the second type of class 2 is a de novo, and that is medium risk, but it is the first device to exist, okay? So de novo means new device, right? And so if, for example, your thing is medium risk, and an example of that is like an electrical device for like restless leg syndrome, right? Like no one's ever invented that before. It is not really high risk, right? Because it's really hard to kill a patient with a device that you just attach to your legs, right? But it is medium risk, and it's the first of its kind to exist. And so therefore they have a little bit more rigor, right? When they're assessing, right? Because they're like, well, it's the first time we're seeing this, right? So we need to do a little bit more analysis. And so note here as well that when I talk about devices, software also applies for this classification as well. Okay, so an example of a class 1 software is an app to track your diet, for example, right? Like that's super low risk. You're probably not going to kill the patient, right? But then an app to manage your pacemaker or to manage some, really severe condition, right? Like cancer or something, that might be considered high risk. Okay. And then medium risk is kind of in between. Now, how do you kind of decide between these? So AI is going to help. So firstly, the AI is going to help. But say you had to do it manually, you basically search up similar devices and then you just go, okay, I've got a similar device and it was low risk, so therefore I'm likely to be class one, right? Or I've got a similar device and it's high risk, and so therefore I'm likely to be class three. Okay, so that's how we do it manually, but AI will help you with this one. All right, next is clinical strategy. So after you figured out the regulatory pathway, you need to answer these two questions for us in the case competition, which is how many trials do you need and how expensive is this going to be? And again, AI is going to help you because obviously you don't know this, right? So AI will help you decide how many trials it thinks is appropriate and how expensive these trials are likely to be based on your patient population and what kind of problem you're tackling. Now, these are some rules of thumb that we have at Biodesign, right? So for a class one device, it usually takes 1 to 2 years, and you actually don't need any clinical trials at all. Okay, so class one is actually pretty simple. You basically just like fill in a form with the FDA, and you've got like an FDA device. Okay. For class two, usually you need around 0 to 2 minor trials, so kind of like smallish trials. Sometimes you can get away with no trials at all, and this will take you about 2 to 4 years. For class two de novo, you will need around 3 minor trials. So again, like kind of smallish trials, and will take you around 3 to 5 years. And then for class three, so these are the highest risk devices, you generally need 3 major trials. Okay. And unfortunately, the cost of the trial is very expensive. So you need to be spending around $10 million per trial. And that's going to take you around 7 to 12 years. For drugs, as you may be aware, drugs, you can really kill someone accidentally with drugs, right? Like if you just have like a spoiled drug. This will take around 10 to 15 years and at least 3 major trials, and the cost can be quite high. Okay. So clinical trials are very expensive. I've seen clinical trials where it costs like, $10 million a patient even. Whilst for like something like a digital health app, it might cost you like $10 per patient. So the range of the cost can be very, very variable. Okay. Um, Okay, so regulatory and clinical. So the goal is to minimize the effort to get regulatory approval. And generally, the strategy is to select the lowest class possible. But like I said, there are trade-offs, right? When you do a class three device, you stand to make a huge amount of money if it's successful. And for class one devices, as a digital health app, like you might not make that much money, right? So you have to consider that kind of business aspects of things when you're deciding which class you want to tackle. Now, I'm going to have you ask some challenging kind of questions here. So I'd love to hear from anyone in the crowd who might have an idea about this. So what is a reason you might select a higher class if the choice exists? So actually, that one might be easy, given what I just said. But why might you select a higher class beyond business reasons?
Any answers? No, I guess. One has an answer. You could raise your hand. No answers from my end.
Okay, so let's say you're a startup and you have a choice between doing a de novo or a class three, right? So you've talked to the FDA and they're like, well, it could be medium risk, it could be high risk, just depending on some decisions that you make, right? One of the reasons that you might choose to do a class three is that it basically forces all your competitors to also follow you in a class three, right? So, like I said before, the kind of way that we do it, and the FDA does it as well, is that it looks at previous devices, right? So, say I've made, I don't know, like this novel device, right? And I look in the past and it's a class two, I can now do a class two and it's a lot easier and cheaper for me to build a competitor device, right? But if I do a class three, it basically subjects everyone else to a class three. So that could be one reason why you might choose a higher class, right? So you'll see a lot of the big companies, like, the big Medtronic, Boston Scientific, they love to play in this class three area because it's a huge amount of money for them and they have a lot of money, right? As a big company. generally as a startup, you do want the shorter option, okay? Because you don't have that much money, and unfortunately, you can't compete with the big guys, right? So that's just a kind of interesting consideration. And then another question that often comes up is there a lower class than class one? Okay, and the answer actually is yes. So there is medtech that is not regulated. And so it's only regulated if you say that your device does any of this. Okay, so you claim that your device or drug cures, mitigates, treats, detects, prevents, or diagnoses a disease or affects the structure or function of the body. So a kind of illustrative example that I usually have is that say you build a mental health app. If you say that you're treating major depressive disorder, which is the formal name for depression, then you are definitely regulated. If you say that you're treating sadness, then it's a bit of a gray area. And if you say that you're improving happiness, then it is not a regulated product, right? Now, obviously, there's trade-offs, right? Like, so obviously, with something like this, you have to get regulatory approval, but then you can use it in hospitals and clinics, like doctors will trust it, right? But then this one, you don't need any regulatory approval. And so you might be able to get into the market faster, okay? So that's kind of where class zero or non-regulated tech also exists as well. Okay, any questions before we move on? So maybe I'll just give a bit of a pause in case anyone has any questions about regulatory and clinical strategy. In case people don't have the link for that, let me just put it up actually. Yeah. Okay, so feel free to write in some questions or whatever you might have, and then we'll keep moving on and I'll answer them later. Okay, so that was the clinical component. Okay, so just regulatory strategy and clinical strategy. Now for the engineering component, there is
Wait,
a
sorry to
technical
interrupt. We have
strategy.
one
Oh, sorry,
question.
yep. Go for it.
We have one question. Sorry.
Thanks, Haikwa. It's Andrew. Just a question about reg strategy. I seem to recall you describing at some point to me in the past, when you go for approval, depending on jurisdiction, so CE, FDA, TGA, the evidence you need to provide, this might sound a bit screwy, but I'll try to articulate it. You need to demonstrate safety, obviously,
Yep.
and also sometimes effectiveness, efficacy,
Yep.
and sometimes you don't for the latter. Can you expand on that a little bit, just in terms of what you need to demonstrate to get approval?
Yeah. So Andrew, I think like highlighted some like I suppose like it's a little bit deeper than what we need for the case competition. But when you are trying to get regulatory approval, there are two things that you need to prove. The first is that it works, like whatever you are trying to solve actually works. And then the second is that it's safe, right? That is, you're not going to kill the patient basically, right? And so when you're doing these trials, what you're trying to measure is one, does it work? And two, is it safe? Okay. And these days, like all the regulatory agencies ask for these two things. Okay. So yeah, so those are two things, but that kind of accounts to the costs, and we don't need you to think about whether it works and whether it's safe. Let's just assume that you do the trial and it works and it's safe. Okay. That's kind of the assumption we have for this case competition. Any other questions? Otherwise, I'll move on. Okay, let's talk about the, oh, okay, question has popped up. Is it a good idea to join a large company since regulatory processes are so rigorous? It depends on your career goals a little bit. Some people just can't work at large companies, right? And so if you work at a large company, obviously you'll just work on, a small part of the project. Startup founders usually work on everything. The regulatory process is not so bad that you can't do it in a startup, though. That's a great question. Okay, let's talk about technical and IP. So technical strategy is just how much will it cost to build your invention? Okay, and we kind of need a number there, and AI will help you generate that number. So just talk to the technical advisor for that. But generally speaking, more novel stuff is more expensive, as you expect, right? And there is kind of like a pecking order when it comes to like engineering. Software is cheapest, mechanical is next, electrical is next, and then drugs are ultra expensive. So these are kind of some of the rough, budgets that teams or startups will have for different types of solutions. So, digital can cost anywhere from here to here. Mechanical's a little bit more expensive. Electrical's a little bit more expensive. And then drugs is like ultra expensive. Okay. But as you'll see, there are like trade-offs to each one. As you can imagine, like when you sell a drug, you can make a huge amount of money from drugs potentially. And so, yeah, there's just like trade-offs from a business side. So that's it for technical strategy. All we need to know is how much will it cost to build your invention and just use the AI's answer for that one. All right, IP strategy. So can you protect your invention with a patent? And if so, what? Okay. And there are basically three criteria so that you can get a patent. The first one is subject matter, which is it something that the US Patent Office allows you to patent? Okay. And what do they allow you to patent? They basically allow you to patent hardware. So anything that's like, you can hold in your hands. They allow you to patent special processes, right? So for example, you might combine like two pieces of information together and then use that to like, create something else. And they also allow you to patent drugs. Okay, so all of these are good. Now, if you've kind of been paying attention, right? Like one thing that they don't allow you to patent is software. Okay, so the US is very strict about this. You're not allowed to patent software. Okay, so all the AI stuff that you have or anything that's purely software, you're actually not allowed to patent. Like you're not allowed to claim a patent on it. Now, there's a couple of other things that they don't allow. You're not allowed to patent natural phenomena. So, for example, like the fact that air exists on Earth or something, right? Whoever discovered that is not allowed to patent that. You're not allowed to patent laws of nature. So, like Newton's law, like F equals ma, you're not allowed to patent that, right? And you're also not allowed to patent abstract ideas. So ideas that there's no hardware component to it. And you might kind of laugh at this, but doctors have tried to patent, for example, like a blood level, like for example, like the fact that your iron might be above 50 or something. Because they discovered something like that, they try to patent it, but that's considered a law of nature. Okay, so the USPTO doesn't allow that. The second thing is that it's novel. Okay, so that is the invention has never been described before in its entirety. Okay, so for example, like when the Lego brick got its patent, no one had ever actually described a Lego brick before. It was like a novel invention, right? Like no one had ever created that before. And what they actually look at is things like research papers, other patents, books, newspapers. They try and like look everywhere to see if anyone has ever described that invention before. So that's called novelty. And then the third thing is non-obvious, okay? And how this works is that the invention is not obvious to someone who's an expert in the field, okay? So, say you invent something and, like it's very obvious that you could have done that, you're not allowed to patent that, okay? All right, so that's technical and IP. So hopefully that's kind of straightforward. The goal is to find the novelty sweet spot, okay? And I'll talk a little bit more about that. Essentially it doesn't cost too much to build, but it's novel enough that you can patent it, okay? That's kind of the novelty sweet spot. And you will need to iterate your solution to figure out this section, okay? Because if it costs way too much to build, then you need to make your solution less novel. If you can't get a patent, then you need to make your solution more novel. And if you can't find a sweet spot, then you need to update your problem, okay? So this is where you need to kind of go back into the Biodesign process if this doesn't work out, and then change your problem or change your solution, right? So that you can find the novelty sweet spot. Okay, so again, pause for any questions. Like if you have any questions, please just post it on the Polev. All right, and then the final part, which is business and reimbursement. So for business, there are two questions that we need you to answer for the case competition. The first is, what's the business model? Okay, how are you going to make money? Now, fortunately, this is pretty straightforward. There are basically just 8 standard business models in medtech, and you just need to pick whichever one of them, or one or maybe 2 or 3, apply best to your problem. Okay, so this is not supposed to be rocket science or anything, and the AI will help you do that as well. So the AI already has instructions about what these 8 are, and then it will tell you what it thinks are the most appropriate business models for you. The second is, what's the US market size? Okay, what's the market size for the US? And how you do this is you basically get a selling price, so whatever you suspect you might sell for, and then you multiply by the total number of patients in the US. So again, AI is going to help you do this. You don't need to find this yourself or anything. And the AI has already been told as well that the selling price is going to be based off competitors, but it needs to match the business model. Okay, so let's talk about the business models. So AI is going to help you decide which ones are appropriate here, but it's good for you to know which eight exists in medtech. The first is disposables. Okay, so stuff that you can throw out. So for example, like syringes. And so you can charge based on these disposables. Okay, so for example, it might cost like $2 every time you get a syringe. The second are reusables. So stuff that you can use over long periods of time. So for an example, an endoscope. And so you charge the hospital will buy one and then just use it for like 2 years or something, and they'll throw it out and then they get a new one. The third are implants. So implants are basically paid by Medicare usually. And so for example, it's like pacemakers and they'll pay you quite a lot of money. The fourth is capital equipment. So this is like stuff that lasts in a hospital for, 10 years or 20 years, right? And these are things like CT machines or MRI machines. The fifth are services. So for example, radiology has now become a service, right? So when you get an X-ray at a hospital, they actually pay a radiologist somewhere else to read your X-ray and then give you a report. 6 and 7 are more to do with drugs, but some devices also use this as well. The first is over-the-counter. So for example, like over-the-counter Panadol, right? You can just buy Panadol just over the counter. You don't need a prescription for it. Or even things like blood pressure cuffs, right? You can just walk into a pharmacy and walk and buy a blood pressure cuff. A related one is prescriptions. So that is you need a doctor to prescribe it first, and then you can buy it at a pharmacy. So it might be things like antibiotics, where you don't want people just randomly buying it. So a doctor needs to verify it first, or things like asthma puffers as well. Then finally, subscriptions. Digital health, every health app basically uses subscriptions. But devices these days are also using subscriptions as well. When you have an MRI machine, they will charge a subscription for the software. And so you'll see that a lot of successful companies have multiple business models, right? So they will make money primarily from something like capital equipment, right? But then they will also have a subscription for the software, and they will also have like a service for the maintenance, right? We don't need to hear all the business models, like unless it's major. We just want to hear the kind of main one. But if there's kind of like add-ons, you're welcome to tell us about it as well. All right, so that's business strategy. The second part of the business kind of domain is reimbursement strategy. And the question that we need you to answer is Medicare going to pay for this? Okay. Now, we're going to dive a little bit more into reimbursement strategy in particular, because it is probably the part of this that most people understand the least, right? And so Medicare is the primary health insurer in both Australia and the United States, right? So obviously everyone hopefully knows about Medicare in Australia, but the USA also has a Medicare as well. And this is super important if your buyer is a hospital or a clinic, okay? If, for example, it's like the patient, like it doesn't really matter as much because Medicare is not going to cover it. But if it is a hospital or a clinic, then you must have reimbursement, okay? Because otherwise they're not going to buy your thing. Fortunately for drugs, and this is where good news comes for drugs, it is pretty much automatic for drugs, okay? So after you launch a drug, about 3 to 6 months later, Medicare is going to cover the price of your drug. Okay, which is why a lot of drugs in America are quite expensive. Unfortunately, it is not automatic for devices or software. So devices and software have a lot of advantages. They're very easy, very cheap usually to make. But unfortunately, reimbursement is what kills a lot of devices and software. And like I said before, if you don't have reimbursement, usually it takes about 6 years so that you can get reimbursement, which means that you're basically existing for 6 years without any profit, right? Which is usually a very bad sign. And so, yeah, drugs have a huge advantage because they only need to wait about 3 or 6 months. So let's talk about how reimbursement works. And the simplest way to do this is actually to think about, say you go on a flight or something and you want reimbursement from your company, right? There are 3 things that you need to present to your company, okay? And the first is code, coverage, and then payment. So the code is, I want to claim a flight. Coverage is, does the company cover it? And payment is yes, you'll get back 80%. Okay, so I'll go through that again. So there are 3 things that you need to have in order to get reimbursed for something like a flight from your company. Okay, the first is a code, which is, do they even accept that you can claim flights? Okay, coverage is a decision by the company on whether they're going to cover it. Okay, hopefully the decision is yes, but sometimes it might be no. And then the payment is how much you actually get paid back. Okay, and so a similar system exists in healthcare. So a hospital wants to claim a surgery. Okay, so say they did like a major knee surgery or something. Is there a code that you can actually use to make this claim. The next is coverage. So does Medicare actually cover it? And then the final question is payment. So yes, the hospital will get paid 2K. All of these need to exist for for a hospital to get paid. And so when you have a novel device, unfortunately, there is no code. Because if you have a novel device, no code obviously will exist, right? Because it's the first time like Medicare is seeing it. And unfortunately, in the United States, to get a new code, and it's the same in Australia as well, it takes about 6 years because Medicare doesn't want to create a code for everything that comes along because it doesn't want to pay for everything. Okay. And so they've basically asked you to do rigorous health economic research to prove that a code is worth it, right? Now, in the US, a code is automatic for drugs, okay, which is why reimbursement is very easy for drugs. Okay, so what exactly are these? And I think this is maybe potentially too much detail, but a code is a legally binding description of a procedure, right? So it just basically describes what it is you're doing. So for example, the surgeon performs a replacement of the knee. Coverage is usually yes, but some codes have conditions, right? So for example, you can't claim free knee replacements, right? Because people don't have free knees, right? Or you might have to try like first line therapies before going to the expensive option. And then the payment is just simply how much is paid. Now, this is a bit of word spaghetti, but this is really useful once you're talking to the reimbursement agent because they're going to refer to different code and payment sets, right? So essentially, you're going to see something in the agent like MSDRG 71. And so you need to know that it's referring to hospital devices, okay? Or you might see something like CPT 9110 or something. And then you need to know that CPT is referring to outpatient devices, okay? And so depending on whether you're treating a patient in hospital or in the outpatient, so outside of a hospital, they will have different payment codes. Okay, so this is more of a reference table because when you're talking to the reimbursement agent, you want to look back at this table and go, ah, yes, I'm talking about hospitals here, or I'm talking about outpatient. Now, we actually want you to present these codes because this is what VCs expect of startup founders, right? And so the kind of line that you might see is, reimbursement is $500 per procedure under CPT code 99621. And it's kind of interesting because VCs about 5 or 10 years ago didn't know anything about this. But I've seen like teams actually be asked, what's the CPT code? And as a founder, you kind of look stupid if you have no idea what this is and you don't even know what any of this is, right? And so we want you to kind of practice that and just be comfortable, understanding that MSDRG is for hospital devices, CPT codes are for outpatients, right? And what specific codes there may be. And you don't need to figure that out again. AI will help you, but it will say something like this, right? It will be like, oh yeah, under CPT 99621, you're going to get $500 per procedure. Okay, I've already talked about this. What happens if you don't have reimbursement? Unfortunately, it's 6 years of applications for devices. But it's only worth it for devices if the market is over $1 billion. And so this is another kind of rule of thumb. And we have a bunch of rule of thumbs that we want you to kind of get used to, right? Because it's probably one of the most useful things is just knowing these rules. At Stanford, like if you have a new device and there's no reimbursement code and the market is less than 1 billion, they basically just tell you to scrap the idea. Okay. And that's kind of like the best advice you can get. Because in Australia, I've seen like, people not have reimbursement. The market clearly is a lot smaller than $1 billion. And people are like, yeah, your idea sounds great, right? And that's the kind of worst thing because you're wasting a lot of time. All right, so the goal of this section is just to maximize realistic revenue. And so unfortunately, this is where everything can fall apart, right? You kind of get to business and reimbursement and the numbers just simply don't add up. And again, we put these rules in the case vignette so you can think about this more carefully when you're kind of going through your recommendations. But kind of roughly speaking, the cost of your trials and your product should be less than 5% of your US market size. Okay. So if you're spending way too much money on clinical trials and building your product and your US market size is too small, then it is simply not worth it to follow the opportunity. If your buyer is the hospital or clinic, then reimbursement must exist unless the market size is more than $1 billion. And unfortunately, if either of the above are false, then you need to iterate your unmet need and solution. Okay, that's why you have to go back through the chain. Okay, so just to sum up the startup strategy, so that's actually it. These are the deliverables that we want from you for tomorrow. And so just regulatory, just the pathway. For the clinical strategy, just the number and cost of trials. Technical is cost to build. IP is can you patent, and if so, what? Business is the business model in the US market size. And reimbursement is does reimbursement exist? And as you can see here, this is all you actually need. Okay. So again, at Stanford, they just basically ask you for this table, right? And they just look at it and you see how very short the table is, right? You just look at this and you can immediately tell how high quality this startup is. Okay. Just based entirely on this. And then you just run through a bunch of rules and you just see whether it checks out. Okay. So a lot of kind of effort. AI is going to help you a lot in terms of figuring this out. But this is actually all you need. And yeah, people just look at this and they're like, okay, like I'm going to give you $1 million based on this, right? So yeah. All right. Any questions? So I'm going to answer some questions before we move on. That's actually it pretty much, except for this final section here, which is very short. So let's take a look at the questions. All right, we've done this one. Let's say you can't decide on one strategy. What's the question here, actually? Let's say you can't decide on one strategy, e.g., just trying to see if I can figure out the question here. Let's say you can't decide on one. So unfortunately, you have to kind of decide on one strategy so that you can figure out this kind of stuff. But then once you figure it out and you learn to do it very fast, you go back on your strategy and you iterate the strategy, right? So that's kind of like the point of this case competition, which is that you'll do one strategy, you'll realize it won't work out, right? Unless you're kind of amazing at this. And then you have to go back and improve your strategy and then redo again and then realize that there's something wrong somewhere and then you have to redo again. And so that's actually the startup founder process. You have like what you think is going to work, you figure out that it doesn't work and the reasons why, and then you update your strategy and then you do it again and then you update your strategy. And so what we recommend for the competition in the AI phase is that you essentially get really good at using the AI to quickly decide if something fails or not. And then once it fails, you improve your strategy, try again, and then try again, and then try again. So it's kind of that cycle in this case competition. For this case comp, do we just ask AI if the idea is paintable? Yes. You just basically describe the solution, and then AI will make a judgment call on whether it's paintable or not. So you don't need to worry about that at all. Oh, okay. Here's the question. Are you allowed to make burner companies and have each one submit a slightly different strategy? Yes, if you have like infinite money. But unfortunately, I don't think anyone has infinite money, so this is pretty hard to do. But like very rich companies might try this, right? If they're very sure that it's a good place to be. They might submit like multiple regulatory strategies. But for a startup, it's impossible to do this. You don't have enough money. When you say US market size, do you mean SAM or SOM? So this is a good question. When you present to VCs, there's this structure called a TAM, SAM, SOM structure. So TAM is the total global market. SAM is the total market in your first country. So we're actually talking about the SAM in this case. And then the SOM is how much you think you'll make in the first few years after you launch. And so the answer to this is we're going to talk about the SAM, but if you're interested, you can look this up, but not needed for this case competition. If we find ourselves in the process of redoing, how do we decide how far back we go? Ideally, we don't find ourselves. Yeah, you kind of think this, but unfortunately, it happens a lot more than you think. Yeah, and you kind of like this is actually the skill we want you to develop in this case competition, which is figuring out how far you need to go back. But I will promise you that you'll probably go back to this needs probably at least 3 or 5 times at least, and you might go back like 10 or 20 times. But yeah, like that's part of the kind of skills of being a startup founder, which is like figuring out when to you need to update the problem because it's just completely screwed, like this idea that you have, or you just need to improve the solution. All right, what is the common profits over income ratio for medtech? Um, I have a lot of questions about this one, but yeah, like profits. So profits over income. You mean like PE ratios, right? Unfortunately, it's lower than tech. I think the kind of default usually is 5. So what that means is essentially the profits that you're making over the amount of money that you need to spend is going to be roughly 5 to 10. So that is, say I don't know, say like you spend like $1 million to build something. VCs will expect that you need to make back about $10 million, right? So it's kind of like a 10x is the basic rule for that. I hope I answered the question, but just let me know if I didn't. Okay. So let's keep going. So kind of the last home stretch now. So the last step is just putting it all together. So the unmet clinical need, the solution, and the startup strategy. And honestly, like your main deliverable is just this. Like we just want to know the unmet need, right? Based on the 5 factors. We want to know what your solution is. And then we just need you to fill out the strategy table. Okay. Now you can present the strategy table if you'd like. You can also break it up into parts. I mean, I suppose the table at the start might be nice just so we can get a feel for this. But this is it. This is like what startup founders will spend years on, which is just iterating this single page of stuff and figuring out what this is, basically moving the pieces of the jigsaw around until it works. Okay. And this is all you need from Biodesign. So it's very, very simple. All right. So let's talk about some general strategy on my recommendations for the competition. The first thing is that you're going to need to iterate your unmet need, solution, and strategy table quite a lot. Okay, so the whole point is you just need to put this together, but then move the parts until you find something that works. Okay, so don't be afraid to delete things. Don't be afraid to, like completely scrap this and then restart, right? Um, I would just recommend like putting this into a Word document and basically working off that, right? And just editing this, editing that, like until you figure it out. Um, it's probably impossible to win the case competition unless you iterate like probably 10 or 20 times. So I think it's a really important skill to develop, and that's kind of the key skill that we want you to develop. The second is that you might have to start from scratch many, many times. And so that question there, like you might have to scrap your unmet need entirely. You might have to redo tree scoping. You might have to brainstorm again. And these are all just tools, right? These are all just tools in the startup journey. And it's never linear. Like I promise you that you're going to have to scrap multiple things many times. Some of you or many of you hopefully will find a plan that works. And then at that point in time, focus on the weakest parts of your plan to optimize. And you can talk to AI to figure out what the weakest parts of your plan is. We have AI agents basically for all of these. So we don't want you to be figuring out what the pathway is or anything. We just want you to generate this table and then look at it in totality and then decide if it's a go or no go, right? And what parts to improve. And there are a lot of trade-offs, right? Being a startup founder, as you'll see, is not easy, right? Sometimes the problem is too large, and so there is no clear patient population, or the market is just unrealistic. If you're claiming that, I don't know, the market is like 10 billion or 100 billion, it's kind of like, are you sure, right? Like, are you sure that your solution can solve it for everyone there? Um, the solution might be too novel for the market size, right? So, just building your product is too expensive, right? Or there's no reimbursement, right? So just it doesn't work out. And sometimes the solution is too generic, like you just can't get a patent. The market is unrealistic from the competition. Now, just a point about the patent as well, that is important. Recall that patents don't work for software. So if your solution is fully digital, the IP can be no. Okay, it is perfectly okay for this to be no if your solution is fully digital. All right, that is actually it from my side. I'm happy to take any questions before handing over to the rest of the team to talk about the platform we've built for you, as well as the rules of the competition.
Any questions before he ends? Nothing from my end.
Okay, perfect. All right, thank you very much, and I'll pass over to Isabella, James, and Mark to close out the kind of teaching part.
Okay, so basically we have a competition platform, which is called Ether. But before I talk about that, I just want to ask you guys, who has a pro subscription for AI? Could you raise your hand? So, okay. Either way, we actually created this platform so you guys could actually use it. I don't have a clicker right now, so sorry, just give us a second. All right, so sorry about that. Basically, we developed like a platform called Ether, and it utilizes agentic AI. We will be going to our break rooms later on, which are up there. And on each table, you have a sheet with a case and also a password and login team for each team. So, yeah. Okay, just a couple pointers for strategic use of AI. Make sure to ask for reasoning, not just answers, because you could ask all the questions and then AI will give you the answers straight up from the beginning. But the teams that would actually win this case competition would be the ones that actually understand the reasoning behind the answers. So that's like my main number one tip. Second of all would be, yeah, just batch your questions, kind of have a sequence for your reasoning while you're prompting the AI. And of course, create precise prompts and utilize the advisor rules properly, which we will be speaking about today. So in the actual platform, you have the advisor, which has a star right there. Press that, and you have 6 main advisors, which are in the fields that we have been speaking about today. So for each one, I would actually really recommend, go back, sorry, yeah. So on the left, you can see the chats. There's 6 main chats. Have one chat for each advisor. And that way it would be the best, way to go around because, so if you actually, okay, before that, sorry. I need a clicker. That's sorry. It's okay. Basically, if you just ask a question, the AI would ask you and tell you that we actually don't understand what's going on. So you have to feed it your problem scope and solution so it could give you tailored answers. So do that, add info, and you're good to go. Next slide, please. And then basically, if you actually ask an advisor who's in clinical trials for reimbursement.
Control it.
Yeah, okay. Some things. Okay. So you have, for example, if you're asking about reimbursement strategy to the wrong advisor, he will tell you that this is out of my lane and I wouldn't be able to answer this question. So don't waste tokens. Now you might see that there's a $ down there, and actually, AI uses computation and that actually costs a lot of money. So there is actually a limit per team to how much they could use the AI because this actually pretty much takes a lot of money. So make sure you actually prompt well and don't end up with a team that spends a lot of money. Each team would have $20 in total, and that's like a hard cap. So you won't be able to spend a cent over $20. And that's basically it. And yeah, just one piece of advice, talk to the advisor as if it's an expert. Don't like half-ask your prompts and you'll be good to go. Thank you guys, and yeah, see you. If there's any questions, please ask. Yeah, what's up, Anthony? Not really, no. So like depending on the complexity of the question and how much you're asking it, it will be different. Yeah. So yeah. Yeah. What's up? So Ether uses .md files, which I don't know if you use Claude. It's basically kind of having it as an agentic AI. So it only answers specific questions, and it has its own kind of basis of expertise. So yeah, chat would be just general. You just ask a question, it'll answer. But this one is actually specialized to actually answer the questions in regards to different fields. Any other questions? Yeah, what's up? No. So you have $20 for the whole case comp the next 2 days, and that's pretty much it. What's up? Yeah, you could definitely. Yeah. But this would actually also help you be more specialized in a sense. Any other questions? That would be all. Okay. That's it. Thanks. Yeah.
Great. So now I'll give you guys a brief explanation about what you guys are actually going to be doing for the next day and a half. So, oh, there we go. So you are consulting for a team of startup founders who are fresh out of uni. They want to do a medtech startup. I think Kwa already briefly mentioned this before, but I'll go into a bit of detail about it again. So essentially for the amount of effort they're putting in, they want to get as much of a financial reward out of it as possible. They're open to using any sorts of technologies, whether it's software, hardware, and they're happy to spend enough time to make sure that they're actually working on the right problem. And so once we actually start the collaborative process, we have actual physical sheets to give you guys with the case brief. We realized it might be a bit redundant for me to read it out to you all because it's quite long and you'll probably forget everything I'll say, but it's essentially a scenario of a situation. And through that, you'll kind of have to identify problem, solution, and go through the entire biodesign process. So yeah, so kind of the first part of what you guys are going to be doing right now is a mini brief. So the mini brief stage is essentially an hour, hour and a half, depending on how fast you submit it, where you can't use any AI, any tech at all. So laptops closed, and you essentially just discuss with your team about the unmet need and most promising solutions that you can find from the brief that we provide to you guys. So we'll essentially give you a form to then submit your most promising, like your unmet need that you've identified, as well as the most promising solutions after that hour or so. And something to also, actually, I'll mention in the next few slides, so I'll leave that for now. And then the second aspect is the final pitch, which is at 12 p.m. tomorrow. So after the first hour, so basically in an hour and a half, you guys will have access to AI and will be able to use the platform that Mark just mentioned to you guys. And that's when you keep reiterating and then go through the entire biodesign strategy process and refine kind of what you're actually presenting. So the judging aspect of it will be judging you based off of the mini brief you submit in the next hour and a half or so. The pitch content, which is the most important part, which is what you'll be presenting tomorrow, as well as pitch delivery, and also a few quick questions we'll be kind of asking after your pitch. They're not meant to catch you out, they're just meant to get you to think more about maybe some of the flaws, challenges that you might have identified during your iteration of your biodesign strategy. So one thing to mention with the mini brief itself is also there's absolutely no stress if some of the solutions that you set on during your mini brief, you actually decide to change once you get access to AI and tech. That's actually part of the process. That's what Kwa was saying, that you're probably going to be reiterating at a minimum of 10 times before you settle on something you really want to present and pitch about. So that's completely normal. We're kind of just trying to assess your thought process and discussions before you get access to AI after that first hour and a half. So for the actual slides that you'll be presenting tomorrow, I'm not going to read all of this out, but this is what Kwa was essentially explaining. At a minimum, you need to cover your unmet need, solution, startup strategy. And I just added a photo of an example that Kwa gave in one of the previous slides. So I'll obviously also give you guys access to these slides so you can always look back to them. And I won't read these out, but this is a deliverable checklist that you'll also find on the case brief that we provide to you guys. So on top of the kind of minimum things you need to cover that I just mentioned in the previous slide, these are just some extra metrics or I guess requirements or deliverables to kind of just ensure that your biodesign strategy is sound. Yeah, so what we're actually looking for is just very clean, sleek slides. So I think it's is it 3 minutes and 15 seconds for the actual, yeah, for the actual pitch itself. So we don't want you guys to rush. And also we want you guys to practice a bit of the Q&A. So what we'd also recommend is to actually chat with AI and ask it, like, what are the sorts of flaws with our biodesign strategy? What sort of questions would we potentially be asked? Stuff like that. But just in general, yeah, we're just looking for it to be well thought out from a biodesign perspective. And if you have time, try and explain your thinking. So insights, lessons, and flaws throughout the process of iterating your strategy today as well as tomorrow. So yeah, this will be due tomorrow right before the pitches. So we'll just get you to submit the presentations before then. Yeah, and kind of what I was already explaining, the purpose is for you to use AI to fill in any gaps, to actually learn about the field and to keep refining your solution as well as your strategy. But for the first hour, hour and a half, we'll get you guys to close your laptops and just discuss with each other. So yeah, that's a bit about that. So I'll provide the Notion page in a bit, but I think it's time for everyone to now get up, and we're going to be moving to a kind of more collaborative space where people can sit in their groups and start discussing the mini brief aspect of the comp. So yeah.